This is advanced perinatal massage, and we are going to go over, I guess, perinatal versus prenatal. Sometimes people don't even know what that is. So prenatal is during pregnancy, and perinatal can be everything from preconception to pregnancy, labor, postpartum, and even some people extend it into the first year of a child's life. And so we're going to go over pregnancy, labor, and postpartum. I might touch a little bit on preconception here and there because I am not just teaching about how to accommodate for a large belly on the massage table. And in a minute, I'll ask about you and what you want to get out of the course, but you will learn that and all the different positionings and contraindications and everything you need to know to work with pregnant women. If you're considering being a doula or attending births in person as well and doing labor massage, you'll learn about that. And then also after they have their baby, what happens postpartum, the contraindications there, and how to support women, babies, families, partners, everything through this whole process. But it's not just the physical, but also the behavioral health. And like everybody watching this, the person you are today has a direct effect on everything that happened, even preconception to mom and dad before you were even conceived goes into that fertilization of the egg and the experiences and the feelings that you have in your adult relationships and how you deal with other people and whether you have a secure attachment and you're bonded with your parent. You know what I mean? It's all that. It's not just structurally, how can we help her with low back pain and hip pain? Because in their mind, when they're on the massage table, the things that you share or the resources that you can give a pregnant woman could affect the way she births her child. And that's some serious stuff, right? And this is really complicated. That's why it's a 4-day workshop. I can't just explain it all in the intro. So we're going to delve into this, and it is really in depth. It should be a degree program in college, which is where I would like to see it head. There are family studies and all that in the psychology courses, but it really should be in physical therapy too. It's huge. So anyway, we're going to go through all of that and all the changes that a person in their body, a woman has when she goes through pregnancy, hormonally, structurally, physiologically, emotionally. And so we'll get started. A little bit about myself and then find out about you as well. But my name's Tammy Recker. I am a board certified therapeutic massage and body worker. And I'm also a certified educator in therapeutic massage and body work. I like to do introductions because it explains my bias, and that's important too. I did get certified quite early on in my massage career. I've been doing it 28 years and got certified in pre and perinatal massage through Carol Osborne Sheets. I'm also a certified birth doula and postpartum doula, and we'll talk about what a doula is later. But basically you're supporting women from during their pregnancy, from the onset of labor all the way through until they have their child, and helping them through that process. I'm also a certified childbirth educator, and I have attended over 115 births plus right now. So I've seen both home births and hospital births, and I've helped a lot of women in pregnancy through massage and just talking to them through that process and all the way through. So a little bit of experience there. I'm also a pelvic floor specialist. I have another class in that, which doesn't get talked about a lot. And there's a whole lot more to it than doing Kegels. There's the whole stability and our core. It's like our inner core. We talk about our abs and our outer core and that kind of stuff, but it's really affected during childbirth is one of those things, but not just that, but I've included a little bit for pregnancy, labor, and postpartum, what happens to the pelvic floor and what we can do about that. I myself have had 2 children. I have 2 daughters at 15 and 21, and had 2 very different experiences during those births, which obviously those experiences led me to wanting to become a doula and help other women and prevent some of the unwanted things that happened to me. And then I've been pregnant 5 times, but I only have 2 daughters, so that means I've had 3 losses. So that's also part of it. And experience with that we can talk about, but both miscarriages, and then also had to go in and have some procedures done where it didn't miscarry, but the baby had died. So I can talk about it now, so that's good. I'm also a certified international infant massage instructor and trainer. And as you can see in the upper right hand corner there, that the Early Bonding Foundation is, I founded a nonprofit, and it's all about bonding and attachment. And I'm not going to go on and on about that, but if you want to get involved with helping moms and babies, check out that. It's earlybonding.org. And yeah, and that's me in the bottom there with not my first, but one of the earliest ones. And that couple there, the baby is in all my infant massage photos in that class. That's the baby, that's the model in those PowerPoint photos. So, all right, so maybe, hopefully that stayed on because I didn't have a way to mute, so I just turned my volume down. So we'll figure that out later. Take a look at what we are going to do over the next 4 days. So today is day 1, and we're going to start with pregnancy, and we're going to talk about the different physiological and structural and emotional changes that a woman goes through and how you can support a woman during that time. And those 3 words, the physiological, structural, and emotional, are important because it will help you later when we go through the benefits, how to categorize those things. And then it also helps you explain the benefits, which is your marketing. So if you can remember that when somebody asks like, well, why would I want to do that? Why would I want to get a massage? You'll be able to explain that in a better way. We will go over a lot of the myths and misconceptions that people talk about during pregnancy, what is safe to do, what is not safe to do, so you feel confident in your skills. We'll talk a little bit about the reproductive anatomy and the pelvic floor, the research that's current, and the history behind this, the safety precautions, contraindications, and of course, how we can position and drape the woman on the table in various ways, not just one way. And then there's a whole bunch of massage techniques that not only will be great for the pregnant woman, but you can adapt these techniques for not just the low back and hips as well, but the whole neck, shoulder, and all these things. You'll be able to do a sideline massage really efficiently for a lot of different populations that maybe shouldn't be prone or supine. So say an elderly person maybe, or maybe somebody who's got a very large, say beer gut, whatever you want to call it, that maybe shouldn't be laying prone, bends their spine the wrong way. And it can also be something that you just pull out here and there, like maybe you do a typical massage, but then you find there's an issue with the pelvis or the shoulder, and you can throw them on their side and do a few of these techniques and then put them back into your normal routine. But so it's not just great for pregnant women, but everything. So we're going to continue this on day 2. And day 2, it's going to be all massage. So today is going to be quite a bit of a lecture, and the second half of the day is going to be hands-on. All day tomorrow, hands-on. We're going to focus on the whole body. We're going to do mostly lower body today, continue it tomorrow, and then the upper body. And we can add into there some other things that would be prior considered contraindications like cupping or taping, and I'll show you safe ways to add some of those modalities, maybe even hot stones, and incorporate things that you normally do with pregnant women and when you can do it and how to do it safely. Day 3 is going to be focusing on labor, the, again, physiological, structural, and emotional aspect of that, and the myths and misconceptions about labor. We'll talk about the reproductive anatomy, pelvic floor, the research, history, and safety precautions, the contraindications, and positioning. There are different positions for laboring a baby and how you can do labor massage and supportive techniques, hands-on therapy, and emotional support during labor. Depending on how long that takes, we might start postpartum, but day 4 is all postpartum. And again, the physiological, structural, emotional. It's considered the 4th trimester for the mom. There's contraindications, precautions, all those kinds of things. We're going to see how we can restore and balance the musculoskeletal system and pelvic floor exercises, what stretches we can do, myofascial release, soft tissue mobilization. If there's any scars, then we can talk about how to work on scars, and a little bit about the benefits of infant massage and how to market your new skill. And then we'll have some evaluations. We'll do the last final exam, and then you'll get your certificate and you'll be ready to go and do this right away. After you leave class, you'll be good. All right, so with pregnancy, again, I'm going to talk physiologically, structurally, and emotionally. Prenatal massage is a set of techniques and standards that have been established to be used when performing massage therapy on a woman during pregnancy that supports those things. And not just the mother though, but also the baby, right? There's not just one person on the massage table. That's kind of what we need to remember, that there's a child inside of that mother, and what the mother experiences, so will the child. So I'm not sure that people understand that there is no barrier in that placenta that grows. And we'll have some demos on all those structures inside. I have some models, and I'll show that in a minute, but just keep in mind that, like, if, you know, a mom's stressed out and has more adrenaline in her body, norepinephrine and those kind of stress hormones, the baby, it goes right to the baby. If mom's feeling great, has dopamine releasing, serotonin releasing, and all those feel-good hormones, and she feels safe and secure, the baby feels that as well. It's like they're sharing the same soul until the baby is born and then starts its own journey. So we have to keep that in mind when working with moms. So some of the physiological issues and how that can affect your work. So obviously, if it looks like the lady in the photo here, they're probably not going to be calling for a massage because they're going to be nauseous. Some early pregnancy symptoms before people even get tested that might happen. They might have some spotting, might feel really super tired. They may get nausea and vomiting, but not every woman gets morning sickness. Might have some abdominal cramping and swollen breasts, shortness of breath, the areola and the nipple gets darker. They might have to go in the bathroom all the time, and might feel like their mood is changing, super sensitive, things like that. And so when your body is getting pregnant, there's all these hormones that are happening, and that affects the urinary system, the circulatory system, the gastrointestinal system, the respiratory system. So maybe if they're feeling all those kinds of things, they may not be coming. And another thing is they call it mommy mind. Might have trouble remembering things, and hormones affect that too. And so it's a good idea that if you have a woman scheduled for massage, that, you know, if you don't have an app or something for scheduling that gives a reminder, text notifications, that you give an old-fashioned phone call and give a reminder the night before and maybe even the morning of, or they might no-show you unintentionally. if they feel good and they come in, sometimes things that we do, like the old Traeger moves where you're rocking or jostling, could bring on some of those nauseating feelings again. So the first trimester is safe. So I think that's a common myth, is that you can, you know, and I think people are getting more and more educated now, but it went from massage being contraindicated during, you know, like pregnancy was a contraindication in massage. Thank God we got beyond that. And then it was like, well, okay, you can do it, but in the left side lying position only, but you know, you can't touch the ankles or the sacrum or the wrists, or you're gonna put them into labor. And
Question.
Yeah,
you can massage during the first trimester.
Absolutely, yeah. At any point you can massage the mom. You're not going to cause any harm. And I think that the reason that people are a little hesitant to do it, the scary part is, and I didn't know this till I had a miscarriage, but 1 out of 5 women will have a miscarriage. And people don't talk about that.
No.
So there's a lot of people having miscarriages out there and not talking about it. And so if 1 out of 5 women have a miscarriage, if you may not have anything, most likely you had nothing to do with it. But if you were the last person who touched her,
you don't want to be blamed,
and then she has a miscarriage, she might think you had something to do with it.
Mm-hmm.
So that's all, really. I mean, obviously, sometimes people are pregnant and don't know it. And maybe if you're in there digging with your fingers and doing psoas work, or, you know, something like that, maybe you're digging in on some of those points that are induction points, but really it's not, you're not just going to rub across them lightly and put them into a miscarriage. And we'll talk about those points and what you can do and what you can't do, what's going to cause a miscarriage, what's not. I will tell you, though, that I've had a lot of 40-plus week women whose doctor was talking about doing an induction if she didn't have her baby in the next 2 weeks, and wanted me to hit those and induce, you know, them. And I, you know, if it worked that great, I would have a line down the block of pregnant women who wanted me to induce them. So even when you intentionally hit those spots, it doesn't quite, it's not like boom, you know.
Yeah.
So I do know that, you know, sometimes when you do everything right and you're eating perfect and you're exercising and you're loved and you're supported, you can still have a miscarriage. And you can have somebody who is, you know, some crack whore that doing drugs all day long and abusing their body and everything else, and they have a baby, one after another.
Yeah.
Yeah. So babies, I've just assumed now they're either going to come or they're not going to come. There are things we can do to make it a lot better and support moms and babies and make it happy. But to think that by giving a woman a massage that she might have a miscarriage because of something you did is highly unlikely. It probably would have happened anyway.
Okay.
But, you know, that's why, but a lot of women don't come in the first trimester just because they don't feel good.
Yeah.
Or they've had a miscarriage and they're scared of having another one, so they're overprotective and they're not going to do anything that might risk it, and they're going to stay home. So I'd have down here, what hormone is the primary cause of many pregnancy discomforts, such as nausea, constipation, and varicose veins? You know what that hormone might be?
Progesterone.
Very good, progesterone. So that causes morning sickness. And those rocky motions, I was saying, that increases the effect. Also, I'm going to talk about some more hormones, but make sure there's a bathroom nearby. Sometimes they'll go before the massage session, and before you're done, they might have to go again within the hour. So you might want to have a robe if you don't have one in your room, or something like that, that they can quick go run to the bathroom and get back again quickly so they don't miss their massage time. So I'm going to take a drink here. It does take a little extra time to work with pregnant women. You know, the big chains, they have to do things on schedule. But if you're in private practice, it's really nice that if you can just schedule extra time, just as if you would with, say, an elderly person who takes a little bit longer to get their shoes on and off. And I've even helped people get their shoes on and off. It just takes a little bit longer to set up the table and change the linens and the pillowcases and set up and get them comfortable. Before you can even start body work, you want to make sure they're comfortable on the table. And it's not a one size fits all. So you might have to do it different with each person that comes in. And you don't want to be rushed. So sometimes, I mean, I usually schedule a half hour between each client, and that's without being pregnant. You can do it, but if you're one of those that needs to reset, center yourself before you work on another person, which I think everybody should, you want to schedule a little bit more time for yourself. And so maybe pricing appropriately so that you get paid what you need. And I think once you market yourself as somebody who's knowledgeable and a specialist in this area, people won't have a problem paying it because they'll feel safe with you. Some of the other hormones that, you know, are going on here. So HCG, I guess it's made a lot of news in weight loss, but that's actually when you pee on the stick to see if you're pregnant or not. That's the hormone that comes up. It's one of the first things that happens when you're pregnant because it actually supports the function of this temporary structure that gets developed when a woman gets pregnant called the corpus luteum. And that actually produces other key hormones for pregnancy. So it's produced by the placenta after implantation. And so that's kind of cool stuff. Progesterone stimulates the growth of the blood vessels that supply the womb and the lining. It also stimulates the lining to release nutrients and nourishment for the embryo. It also helps or inhibits the contraction of smooth muscle of the uterus so that it grows as the baby does. So it allows it to grow. And progesterone along with estrogen promotes the growth of the breast tissue and the milk duct. So the development of that, so we can lactate later. So it actually prevents lactation during pregnancy. So, and then it only starts when the levels of progesterone drop. After you have a baby, when the levels drop, then the milk will come out. So it plays an important role in the preparation of birth. It strengthens the pelvic wall and the muscles that you're gonna need for labor. And it also causes increased hair growth during pregnancy. So there's a lot of weird things that happen when you're pregnant, like women like all of a sudden might see hair growing in places they didn't have before, you know, like mustache around their nipples, on their stomach.
I'm already hairy.
Yeah, well, it's all temporary and it's worth
I
it.
already have hair everywhere.
Oh, these kids are worth it, I promise. But, you know, it would be nice to know, like if you looked at the list of everything that happens when you're pregnant, you'd be like, I never want to get pregnant, you know, like I'm going to barf, I'm going to have diarrhea, I'm going to get like weird marks on my body, I'm going to get hair. I'm like, no, like literally everything will change in your life when you get pregnant. And so, you know, this is what we should be maybe telling younger kids, not only about this, but like what it takes to raise a child emotionally, what you need in a partner. I mean, how much money it takes, what the support you need from friends, from family, from your partner. It's huge. And so to go out and just have sex, right? Like, okay, you're young and you're horny, but you got to take this stuff seriously and either abstain or use protection. So, because if we did that, then, you know, we wouldn't have the whole abortion issue either. And that's a whole big ball of wax as well. But I mean, instead of just saying, don't do it, or you can't, you know, have the abortion issue, if you just explain what happens and what's going on, it makes you think about doing it and who you're doing it with and what would happen if you got pregnant with that person. And, you know, so, yeah. And then let's see, I talked about that. Did I talk about estrogen yet? I don't think so.
No.
So it's actually, estrogen isn't just estrogen. It's a whole collective thing of a few other compounds. There's estrone and estradiol and estriol. So, but basically this whole group helps the uterus grow and maintains the lining and supports fetal development, the whole environment in there. So including the development of the organs and the body systems of the baby. And it activates and regulates the production of other pregnancy hormones. So one hormone affects another hormone. And then there's prolactin, which is the main hormone that is needed to trigger the production of breast milk. And it enlarges the mammary glands to prepare for this. And it contributes to the development of the baby's lungs and the brain and the mother's immune system to tolerating the baby. So like sometimes when these hormones aren't all in place, that's why women will have miscarriages, because they're deficient in some of these hormones, and everything has to be in place perfect for the baby to turn out right. Oxytocin, the love hormone, has a, it's actually the highest level you'll have is right at birth, and that actually helps with bonding and attachment. It appears in significant amounts towards the end of pregnancy, but it's also present in lower amounts before this. It's actually the hormone that you feel when you have an orgasm, that warm feeling that you have, and why they say just make love, right? Because the act of having an orgasm makes you fall in love with somebody, and it makes with bonding and attachment to another human being. And so levels start to rise when labor starts, and you might have heard of Pitocin. That's the synthetic version of oxytocin that starts labor contractions. So it's present in all of our life. Men and women both have it. And we'll talk about it more during labor, but it's a very, very important hormone. And then relaxin. This is where the massage therapist should start listening, because relaxin levels are highest during the first trimester of pregnancy, but it's pregnant throughout, and it has several different roles, including prohibiting the contraction of the uterine muscles to prevent a premature birth. But just like the name sounds, relaxin, it relaxes the blood vessels, it increases blood flow to the placenta and kidneys, and that helps the mom cope with an increased demand for oxygen and nutrients from the developing baby. And it helps by relaxing the joints of the body. So when you have a baby, the baby has to go through the pelvis. So that has to, those bones have to come apart, and the baby has to go through. So the relaxin affects that and allows those ligaments to stretch, but it doesn't just affect the pelvis, it affects all the joints of the body. So as your the baby gets bigger and the weight comes forward, your body has a different gait when you walk, and you have to balance different, and your core is not the same. So those ab muscles are not supporting you how they used to. They're moving to the outside, and as the baby gets bigger and bigger, that low back muscle has to compensate. And so we get this hyperlordosis in the low back, and those muscles get really tight. And the gluteus medius and all those glute muscles get really tight as the hips start getting wider and wider with this external gait, and you're waddling. And so a lot of women will get these trigger points in their gluteus medius from the external hip rotation. And it's affecting all the pelvic floor muscles as well. So that's why in later, as the women in maybe third trimester, it's all like, oh, my low back and hips, you can guarantee that's going to happen. But there's also an overcompensation, so they might get like really bad in their neck and shoulders, and then they can't sleep on their back at all, so they're sleeping on their side. And a lot of women sleep just on their left side, and we'll talk about optimal fetal development and why they do that. But pretty soon their left shoulder starts getting really bad, and their left hip, and it's like they get bursitis and trochanteric bursitis in their hip. And so this is why they start calling for a massage, is because of all these structural issues. Let's take a look at here. So we have all that joint and connective tissue strain, and then increased weight coming down, and the relaxin hormone in the body. So, you know, structurally, massage techniques can reduce those strains placed on the musculoskeletal system, and the stress that it causes on those joints and ligaments. So a lot of pregnant women, their feet, their arch starts disappearing, and they might get like a flat foot and stretch all that and feel like they have plantar fasciitis, or just like their knuckles and their bones and their feet hurt and feel like they're bruised because there's so much extra weight coming down. And like, say, a pregnant massage therapist who's standing all day long might be different than, say, a desk worker, somebody's on a computer sitting all day long. Those will be two different types of massages versus somebody who has a multi up and down all day long, a little bit of everything. They'll be more balanced. So too much or not enough, that's anybody, right? For too sedentary, we're going to have issues. And if we do too much working out, we're going to have some issues there as well. So let's see. And then that, you know, the workload that the body entails, carrying around the extra weight. So maybe a baby's born is 7-8 pounds, but then you have all the waters that's in there as well. If you gain no weight at all, it's somewhere between 25 to 28 pounds on average for a woman to be carrying around. And that's if you don't gain any weight. And most women do gain weight during pregnancy. So anything above that is like your body weight. And it's not uncommon for somebody to gain 60, 80 pounds during their pregnancy, including the baby. And then, you know, some people lose it in the first month, and usually lose like 25 pounds in the first week. It's kind of crazy. And then anything beyond that takes like a year to take off. Some people, they bounce right back, and some people take, I don't know if I've lost mine yet. No. But, you know, I mean, everything changes. So, and it's different from one birth to another. Some women will have one baby and get thinner and more cut up than they ever were after that first child. And then they have another baby, and it's not the same experience. You know, it's a lot harder the next time, right? But, yeah, so we'll talk about some of those things, and maybe when we have our pregnant volunteers come in, we're working on them, we can talk to them and see what they're experiencing. Every woman, it's really important to do active listening and see what they're going through. And it's really important also not to share any scary stories that maybe if you've had a baby, that if it wasn't such a good experience, or I don't know. I remember somebody saying, you know, to me about like, I don't know why anybody would have a natural birth. You know, I wouldn't get a tooth filled without Novocaine, or, you know, whatever. Why would you have a baby without an epidural? Like, you know, that was an opinion, but if you trust their opinion, you take it to heart and you like consider that. And then you might start thinking that everybody who has a natural birth is crazy. But has anybody had a natural birth, or have you seen a natural birth? Have you seen a home birth versus a hospital birth? I've seen a lot of both, and I'll say that there's definitely an easy way and there's definitely a harder way. And most of the time, that's those epidurals and interventions and all those kinds of things make it harder. You don't think it is, but it's like you're trading one thing up for another. Making one thing maybe easier in a moment, but then it snowballs and there's a bunch of other harder stuff that you have to go through later. And it also increases the C-section rate. So we'll talk about that stuff during the labor part, but you know, the things that you say and the way that you affect a pregnant woman, I mean, you can talk to a 90-year-old woman and she will remember every single person she talked to when she was pregnant. It's like no time has elapsed. The way you were made to feel, the things people said, and how you'll go back and relive it. Like, if I had done this, if I had done that, then this wouldn't have happened, or this, or I should have done that. And that person said this to me, and oh, that nice person did this to me. But if you help a pregnant woman, they will never forget you. They'll be like, that massage therapist supported me and whatever. And even if there's stuff going on at home or whatever, you might be that one person who actually is listening to her while you're massaging her. You may not say one word except validating her feelings and like, wow, that's a lot you're dealing with right now, you know. And then hopefully by the end, you'll have a lot of resources, a lot of, well, have you read this book? Have you seen this DVD? Have you interviewed this doctor? Have you interviewed a midwife? Do you know what your choices are? What kind of childbirth education classes are available, which are, you know, more beneficial to the kind of birth that you want to have? There's a lot that goes into it that you might not even know while you're giving a massage. You might be like, oh, well, I did this. You know, trying to empathize, I've been through it, but every woman's experience is different, and each pregnancy with the same woman will be different. So really keep your experiences and your opinions to yourself, and try to instead provide resources for her to read or watch to come up with her own idea about that, her own opinions about those things. Okay. So let's look a little bit more about the structural issues, and then after that I want to talk about emotional issues, but I have quite a bit of stuff here with the structural and what we can do to help them. This photo here you can see on Google Images. It's everywhere. Any book you read, this picture's in there, so I figured it would be safe to share. Because I don't know who had the rights to it. There was no information, but if you, well, we could probably stand up and do this a little bit, and you can read about this, but so if you're not pregnant, let's just stand up, and I don't know what you can see and what you can't see because I don't have my picture-in-picture. I got Allie here. So, but basically, when you're standing upright, we know what that is. Our head's above our body and everything. So just take a second to like feel your feet on the floor, and it's kind of good to do the mindfulness anyway. Like, yes, I am here. Breathe. All right. So let's now pretend that we're starting to get a little bit of weight in our belly. So we'll just kind of like, you know, like when you're sticking your belly out on purpose, nobody likes to see that, but you know, well, we'll do it anyway. And you can almost already feel a tension in your low back when you like stick your belly out like as hard as you can and bloat it. And then make your breasts heavy, like pretend you have a couple cantaloupes they're pulling down, or like you just put like some 5-pound dumbbells in your bra and it's pulling you down. Sorry if guys are watching this, but you get the picture, okay? So maybe feel like it's being pulled down. So you can't walk like that, right? So you got to compensate. So your head's going to come back so you can see, but you can feel now like it just pulling across your neck, across like C7, like the dowager's kind of thing. If you stayed like this, it's not very comfortable. If you walk, you kind of start to waddle. And if you just take a couple steps and walk, you can see how you might feel tightness in your IT band and your peroneal in the side of your leg and your glutes and right, gluteus medius minimus, TFL, like that area, all those areas are affected. And so sometimes just like when you're sitting in a chair and you don't catch yourself, like you'll catch yourself like slouching or whatever, and you sit up straight or whatever. Pregnant women, after a while in that body, they get used to it and they don't realize that they're, you know, walking like that. So if you see that when they come in, you know, you can have them stand against a wall, but there are some experientials that we can do in here. I have them in here, let's see. I have one in here I'm gonna show first and then we'll do it. So the pelvic tilt is really a cool thing to master. And, you know, you can get on all fours and do that if you want, but basically if you don't know how to do a pelvic tilt, I like to explain this to a woman before she gets on the table because there are a lot of active release or myofascial type of massage advanced techniques that we'll be doing that involve them doing a pelvic tilt in a sideline position. And I don't like going, okay, well, you know, do this in front of them, right? So, and I don't really want them to get on all fours on the table, but, you know, when I'm talking to them on the phone before they come in, I may ask them if they know how to do a pelvic tilt. If they've done yoga, maybe they know cat-cow, but we're not really doing the whole spine. We just want to move the pelvis. So the intention is to really educate or re-educate the client in efficient activation of their psoas muscle for proper alignment for their lumbar spine and the pelvis with the legs, and to promote femoral circulatory flow by encouraging the proper support of the uterus in the pelvic bowl, and to reduce pain and strain in the lumbar spine and sacrum, and to tone the psoas. I'm going to talk about the transverse abdominis that holds everything in and how it works with the pelvic floor, so that'll be secondary. But we really want to have them just be able to move their pelvis. So it works with breath, which is also really good to know when you're pregnant because we breathe during labor. And so if they can learn how to do this during pregnancy, and it helps prepare for birth. So what we would do, and I'll just kind of talk through it too, and you can, at home, you can lay down on your back, you can go on all fours, you can sit in a chair, you can stand up, whatever. But we want to inhale first and then initiate the pelvic tilt movement as you exhale. So when you let your breath out, your abdomen should come forward to your back. This happens naturally during an exhale. An effective pelvic tilt will utilize this leverage begun when the abdomen pulls in during the exhale. Just continue the pulling and see how far you can tilt the bottom of your pelvis up, and this will result in your low back gently stretching and reaching in the direction of the floor or the wall. So I'm going to grab my pelvis here and just show with the pelvis too. Maybe I should talk about paradoxal breathing and everything, but basically when you breathe in, naturally your stomach should be relaxed and go out. And when you exhale, your stomach should come in, right? Inhale out, exhale in. And then while that's happening, the pelvic floor should be on the exhale coming up. When you inhale, the stomach goes out and the pelvic floor goes down. And when you exhale, the stomach goes in, the pelvic floor comes up. The pelvis here, so when we are inhaling and our stomach goes out, we can go into this like anterior tilt. So if I have this bowl here and I'm going to tilt it forward into an anterior tilt, filling up, and when we exhale, our stomach comes in, and it naturally, it's like your tail. If you had a tail like a dog or whatever, our coccyx bone here, like if you think of that being pulled down and through. And some people even like with, instead of Kegels, you know, like clenching or whatever, if you think of like closing your anus when you're exhaling, like we're clenching. It's not just clenching, but it's also like an elevator, bringing that whole muscular floor up. And I'll show more of that, but I could take my pelvis and I can be like, okay, you're on your side now. And so I want you to move your pelvis like this, like back and forth, right? Or when we're standing, I want you to move your pelvis like this, just your pelvis. When you're on all fours and you're moving it like this, but not everybody has a pelvis. But however you want to describe it, it's an important motion, and it's really important during labor as well, to learn how to move your hips in that fashion. And we don't really think about it, but we just want to always come back to neutral as well. So we're not going to stay like either way, and then we come back to neutral. So tuck and come back and forth. So we don't have to say anterior tilt or posterior tilt. We can just like, okay, go forward, go backward. And we can even do like a passive tilt with them and help them move their pelvis. So we'll do that when we do the hands-on. Okay. We could also do some just experientials if they're not getting their structural alignment of their body. One of these things that you can see me doing here, and you can even do it in a chair, but if you would imagine the area like behind your ears maybe, and it's being lifted up, it kind of brings your head into alignment, right? Or a string attached to the crown of your head and somebody's pulling that string up to the ceiling. You can feel those vertebrae in the cervical area just kind of separate when you do that. I might even just like tap on the top of their head like here and be like, okay, feel like a string's attached here and now it's going to be pulled up. Do you feel your neck getting longer? And they're naturally, their chest comes out and their head comes back. Or you can pretend there's a string on your sternum and somebody's pulling that out to the wall. So if they're all concave and their shoulders rotated in, and you pretend there's a string here and somebody's pulling that string, right? They're pulling your chest back out. That's another common complaints that you'll see. Again, it usually, it starts like in the middle towards the last trimesters when I see the most amount of pregnant women. The earlier I can get them in, the better. Then it'll actually prevent a lot of those problems happening later on. So if you find out somebody's pregnant, encourage them to come in, tell them it's safe and that you'll work with them. So the sacroiliac joint definitely is an issue, and we'll show that when I have fetal alignment, because as the baby gets bigger and bigger, it's going to kind of usually be on the left side, which makes this whole ilium move. And so, and we have the iliums moving out. So these joints here are getting compressed, almost like arthritis, like bone on bone. But then you'll even have like one ilium forward and one ilium back. And then one's going to be like higher, one's going to be lower because of the weight of the baby on one side versus the other. So babies don't just like take up the entire area. The head is heavier than the rest of the body and the spine's heavier than the rest of the body. So with gravity, they kind of start to position themselves into one area, which is good for labor, but it does cause a lot of body pains, and we're going to see more and more of that on the demos. But that's why the sacroiliac joint hurts. The lumbosacral joint hurts. Again, with that hyperlordosis and that coming back, you can see here's a couple of vertebrae, and if you're always in that anterior tilt, you're going to start getting pain right here in this joint, right, as it's going like that, and more of that bone on bone and those nerves getting pinched in there. The pubic symphysis here, right, and we'll do it here so you can see too, moves in all directions. So as the relaxin is affecting, normally it doesn't move, but as relaxin comes in here, it gets more loosey-goosey, so it can separate for birth. And again, when the baby goes to one side and there's round ligaments, this can move as well and cause a lot of pain. I have some quick fixes for that. The round ligament, I'll just go ahead and grab the here. Can you see me in the computer?
Yes.
Okay. So this is the...
Oh, wait. Only the blue and white thing, not the pelvis.
Now you can?
Yes.
Okay. All right, that's good to know. Maybe I can tilt it down a little so you can see better. How's that?
Maybe, yeah, and I don't know if I can enlarge the screen. Oh, no. Okay.
Can you see it now in this
Yeah.
position? The whole
Yeah.
thing? Okay. So this symbolizes the uterus, and the white and blue are like the bands of the muscles that are in there. And then these strings that are on each side are the round ligaments, and they attach higher up on the uterus. And then where they attach down below is actually, let's see, one on each side. So one will be here. I'm gonna try to hold that knee blade with our hand. And then the other one here, right? So that's kind of where it sits. And then when the baby gets really big, it might, like say it goes to the left side and everything's hanging this way, what happens is this band can get really tight and it'll pull this bone up and get an upslip in there. That can be really painful. Sometimes women will feel round ligament pain up higher, and this might sit like right under the rib cage. So they might feel like they have pains. Oops, I just throw my uterus around. So they might feel like they're having pains way up here, where other women with round ligament pain might feel like it's way down there, like in the groin area. And some women feel like it's right in the pubic symphysis in that area. And that's all can be caused by round ligament pain. And is this still a good angle for me to be at, or should I tip it again?
I think it's fine.
Okay. There's also the broad ligament, which affects the glutes and the leg, and the sacrouterine ligament causes low back, butt, leg, and causes the forward tipping that women do. So, 48 to 56% of pregnant women experience back pain, and mostly in the low back and pelvis. So some statistics there. 50% say that they have sacroiliac joint pain, 25% say they have upper back pain, 25% of women say they have lower back pain, and only 1% actually have true sciatica. But that'll be a common thing you'll hear, is that like, oh, I have sciatica, but really it's this sacrotuberal ligament, and all those deep six rotators in the hip that are working really hard to support mom. And yeah, so I'll show that when we have you on the table where those ligaments are. And I think I have some illustrations in here as well too. So then we have the pelvic floor, and when we get into postpartum, I'm going to spend more time on this, and I have the anatomy and some videos and things like that. So I'm just know that it's a group of muscles that sits down inside of the pelvis. There's these superficial muscles on the outside and the deep muscles on the inside. And as a group of this muscle, that they contract to hold things in, like, if you have to go to the bathroom, like, so it holds in urine, it holds in gas, it, holds in stool, holds in your organs in your body. But it also contracts to stabilize your lumbopelvic region. And then there's sexual performance stuff too, like having an orgasm or achieving an erection. Like, they have all these commercials for guys about, oh, low T and blah, blah, blah. Well, sometimes they just have too high a pelvic floor tone, and they need to learn how to relax it. So we need to sometimes keep things in, but there's other times we need to let things out. Or so, like sometimes we need to let things in, like if we're going to the OBGYN and we got to have a speculum go in, or a tampon for, a young woman first learning how to use a tampon, or a digit, or a penis. So we have to relax, or it hurts to have things go in. But we also sometimes have to relax to let things out. Like you don't push urine out, you have to relax to pee. or a baby. Yeah. Sometimes we have to relax to let stool come down, and then it's just a little bit to taper it off. And that actually has a lot to do with having a baby. Most of the time we need to learn how to contract it and have healthy tone. And then we learn how to do that and get all good and tight. And then we get pregnant and we have to learn the opposite, how to down train, which is like a reverse Kegel. And you have to learn how to relax the pelvic floor to let the baby out. So, but if it's too loose or too tight, either way, you might have the same symptoms. So it's really good that we learn more about pelvic floor dysfunction. I do have a class on that because, you know, a lot of people don't, you know, you think like, oh, you know, either you've had a baby and postpartum, there's going to be a pelvic floor issue because a baby came through there, or you're old, you know, and things wear out and you're just getting older. It's normal to, you know, pee your pants or pee when you sneeze and have a little chuckle over it. But really, no, that's not normal. That's just lack of education. And there's a lot of people suffering with urinary incontinence and urge and sexual dysfunction and can't have an orgasm and, you know, can't get it up, whatever. I mean, men and women. So, but, you know, as a massage therapist, you know, we might, that's kind of like out of our scope. We don't talk about sexual things, but it does affect, there's a lot of muscles that are really close by the pelvic floor, like the psoas muscle or the obturator internus and all these things. And those ancillary muscles actually can affect whether we tone them or loosen them. So we can help with those things. Let's see, what else? So if somebody has overactive, and it can be a lot more than just overactive and underactive. There's a lot of variations in between that too. So they're not, like I said, contracting as they should. They're having problems. Maybe they have to go every hour, you know, and sometimes it can be, you know, posture. It can be childbirth trauma. It can be surgical trauma, adhesions. It can be maybe your skeletal, you know, you have subluxations, you're not in line. It can be from past abuse. It can be from diet and unhealthy eating or drinking too much, or, you know, like if you eat wrong and you're having constant diarrhea, it's going to affect your pelvic floor. Or if you're not having enough moisture and you're constant constipation, that can affect it. And if you're constantly bearing down for years and years, that can affect your pelvic floor. And you kind of guard your muscles. If somebody had been abused, maybe sexually in the past, or they had a traumatic birth, they might have the opposite of having this loose hammock and stuff like that. Maybe they draw it up to protect themselves, and they might have a hard time having a baby. So, you know, if you're a PT or behavioral health or some of those things, you can ask certain questions, like if they're sexually active or if they're orgasming. But as a massage therapist, we might have things about their digestive dysfunction on a checklist or on their intake form, you know, if they are having any problems with irritable bowel or regular bowel movements, are they straining? Sometimes those things are in an intake form, and we could use that information to find out more stuff without delving into the sexual aspect of it. But we don't want to assume that they have this low hammock and there's no tone in their pelvic floor. A lot of those things can come up either way. And it really needs to be addressed before they have a baby. And so the acronym there, LBP, if you know, hopefully you know, but that's low back pain. So perinatal low back pain. It really, what we need to do is what I was talking about, the transverse abdominis, which is like the sheath, and I I'm going to do more about that. Let's see if I do it now or later. I think I might do it now. We'll assess it later, like postpartum, but I'm going to touch on it a little bit here. But the pelvic floor muscles and the transverse abdominis, they have to co-contract at the same time to stabilize your body. And it actually happens unconsciously. It's an anticipatory thing. So like if you're thinking, I'm going to go lift up this dumbbell, the pelvic floor and the transverse abdominis have to co-contract before you pick that up, and will happen before you even lift it. And it works with breath as well. So if I'm going to lift something heavy, I would want to take a deep breath, let my stomach hang all out, let it all hang out. And when I exhale, I'm going to stabilize my abs and my pelvic floor, and exhale as I bring it up. And that will help protect my low back as I'm lifting. So maybe if you've done personal training or you've been lifting weights for a while, you know that that's how they have you breathe. You're inhaling as you put it away, and you're exhaling as you contract the muscle, right? And that's why you're doing it. But if that's something that also personal trainers, if you have dual certifications and you're also a personal trainer, have people learn how to contract their pelvic floor as they're doing it, and that will serve them well. If they don't co-contract on cue, then that's when we have problems with urinary problems like incontinence or gas, can't keep it in, pelvic organ prolapse, that could happen during childbirth too, or just over time with enough gravity and enough time with weak muscles. And it can cause severe low back pain, and with sacroiliac instability, constant pain in the SI joint. So if you are massaging somebody, whether they're pregnant or not, and they constantly have low back pain, and they constantly have SI joint pain, and they constantly have hip pain, and you've been working it, and you've been doing myofascial release, and you've been doing all this stuff to relax that area, and they're not getting better, then that might be like, maybe it's pelvic floor dysfunction. And that's when you want to have a good referral network where you can refer out. There's actually physical therapists that specialize in pelvic floor dysfunction. Not everybody does. They all learn about it, but not everybody specializes in it. And so that's something. And then when you work with women postpartum, they might want to try to overtrain to get their abs back, and doing like 1,000 sit-ups a day kind of thing, and doing high impact aerobic jumping type exercises to try to lose weight. And they're not ready for that yet. So we'll talk a little bit about that postpartum as well. So some of it can just be you're not toned and trained, and other times it can be from an injury, from a use of forceps, a really long labor and that constant pressure coming down. A large baby, it seems like more and more these days, I don't know if it's the amount of sugar in our diets or what, but babies are getting bigger and bigger. I've seen a lot of 10-pound babies being born. And if you have a pelvic floor that can relax, I've seen them born without a tear or anything. And there's not interventions and things, not a tear, healthy pelvic floor afterward. So we'll talk about some of those interventions and what can lead to tears and what women are scared of. That's something when they're coming for a pregnancy massage, they might confide, like, I am scared to death. I want to get an epidural because I'm so scared and I don't want to feel anything, and I'm scared to death of tearing. And but really you're more likely to tear if you have that, and I'll explain why later. But there's just so much things that people don't know, and they set themselves up for the very thing that they're afraid of. So and other things are like people with asthma. So if you already know they had asthma before they got pregnant, that's a lot of intra-abdominal pressure, constant squeezing. And every time the stomach squeezes, the pelvic floor comes down and pressure comes out. So that's something to consider as well, and to be knowledgeable when you're working with a woman who is going to have a lot of intra-abdominal pressure and pelvic floor pressure that these things can happen. And I just use this barrel as an example of what our myofascial core looks like within here. So on the bottom, we have our pelvic floor that's holding everything in. And on the top is the diaphragm. So that's like the cap on the jar. And they work together. And then we have the transverse abdominis, that's the sheath all across the front. On the sides, we have our oblique muscles. And then in the back, we have our multifidi around our spine that helps hold it in there too. So this all works with fascia and keeping everything together. And then it stabilizes our spine. I like this cross section here because it shows how close everything is together. You can see the vertebral body in the center there. And look at the psoas that's right next to it. See how big it is and how close it is to all those structures there? All right, so it's not a pelvic floor muscle, but it's really close to it, and it has the same fascial connection. So sometimes when people have psoas dysfunction, it's really affecting their pelvic floor. That's good to know too. There's a lot of high-level athletes, female athletes, they're actually more prone to pelvic floor dysfunction and have a harder time having a baby than a non-athlete sometimes. And that was actually my case in my first birth because I did triathlons, I did a lot of cycling, a lot of running, and my psoas muscles were so tight that if I laid down, there's no way my leg was going to go back. I had to really work at stretching my psoas muscles. And my pelvic floor was so tight, I could not relax it. I had to do the opposite of Kegels and to relax. So, you know, sometimes it's preparing your person that you know is going to have a baby by working flexibility in those areas. A lot of those type 1 fibers have a continual tonic force between 1 and 25%, whereas maximal voluntary contraction forces are as low as 1 to 3% and can provide stability in low load tasks. So like I said, there's an anticipatory recruitment of, you know, irrespective of the direction of load. There's muscles, and I haven't really talked about those yet, but I'll talk about those things then, about how they respond to load and recruitment and how it helps with local stabilization. So for example, at L3 on the spine, the psoas could do the job locally to provide stabilization for a woman when she's pregnant, but globally, you're going to have your transverse abdominis, your obliques, your multifidi, all those, etc., to join in and stabilize. So you don't have low back pain while you're walking down the street, versus compared to doing like a plank, right? And we're going to have to really contract all those things. And if you don't contract the pelvic floor muscles at the same time as you do your transverse abdominis muscles, that's when you can develop dysfunction globally and have a lack of stabilization in your body. And this is just like an experiential that explains this a little bit. So I put down, have you ever told a child to stand still? Right, and they're swaying around. So maybe not, but maybe you can. Can you do it? So let's stand up. Have you stand up, and then, right, I don't know. But you're gonna have your feet just slightly apart. And then I'm gonna have you, as you're standing up straight, you wanna just kind of like bend at your ankles and kind of lean your entire body forward a little bit, but stop before you lose your balance. So you're bending at your waist, just stand straight up.
Oh, I didn't notice that.
Yeah, you're just gonna like go forward at your ankles, just kind of, you know, but don't lose your balance. You're just going forward and then come back. And you can see how like the plantar flexors in your feet engage to bring you back to center. And we can turn back a little bit, and you can notice like the dorsal flexors on the top of your feet kind of get involved to bring you back to center, right? And that happens unconsciously, so there's no way to just really stand still. Even when you're at your most stable upright stance, there's always going to be like this little bit of undulation as your body is moving, and that's just a reflex called postural sway. So there is a normal amount, which is usually like front to back, side to side. It's about 8 inches or 20 centimeters if you're one of those people, in diameter, left to right. And you can do it when you're sitting, I think, a little bit. People sway. But you should always return to your center of gravity. And what that is your inner core that I was just talking about, and how that works with your body. So that changes when you're pregnant. You can see here, if you look at the illustration, so the center is your spine. And so it's kind of like guy wires, if you've ever seen something. So if you're trying to like hold something upright, or like I think of putting a mountain bike. So before I got a bike rack, I would stick my bike in the back of the truck, and then I would take straps and I put it like around the frame of my bike, and I put one down to tie down on this side, and then the opposite way, and each way, and my bike would be standing upright, but it's not going to move at all. And our body does the same thing. So attached kind of from our spine, we're going to have our rectus abdominis in front, kind of pulling us forward. We got our obliques on the side to side. The multifidus is in the back, right? We got all the erector, paravertebrals, those kinds of things. So we have all these things kind of holding our body in place. And so the dysfunction presents tightness or overactivity or spasm, and can cause problems across joints at a regional level and affecting the whole global stabilization. So that's when we use our things like our prime movers, like the quadratus lumborum in a pregnant woman. We're going to spend a lot of time on that today, because that's one of the key things that help a woman when she's pregnant. The QLs get like just overworked and really sore, and there's some really cool active release things that we can do to help them with that. And it's also a really cool thing for non-pregnant people. If you've worked on the low back in other ways, in the hips, and you're missing the QL for short, that's something that will be a real quick fix. Yeah, it's gold for helping people with low back, and sometimes even like sciatic problems and things like that. You work on the QL and it lets everything go the other direction. All right, so some considerations when working with women during the perinatal period. The pelvic floor muscle exercises should be something that could be included in the first line of conservative management programs for women with stress, urge, or mixed urinary incontinence. Those exercises could also be included as a first line treatment for urinary fecal incontinence in antenatal, or like during your pregnancy and postnatal, so postpartum period. They definitely could benefit from that. Several studies have found that pelvic floor muscle exercises during and after pregnancy are effective in reducing the incidence of urinary incontinence during pregnancy and postpartum, and increasing pelvic floor strength. But unfortunately, evidence suggests that nearly 50% of women get absolutely no information about pelvic floor muscle exercises or urinary incontinence while they're pregnant and during the postpartum period. And over 40% of postpartum women have never even heard of pelvic floor muscle exercises. And, you know, it's a really easy thing to learn, but that's basically another class. Let's see. Also, reactions to physical and mental stimulation. So there's an emotional concept with this too, and a chemical connection between a a pregnant woman and her baby. The connective tissue stores cellular memories of the past, and those memories are expressed by the baby inside of the womb. Those cellular memories are inherited thoughts, attitudes, and feelings that our parents had before we were ever born. And because these memories are energetic and cellular, they can be addressed within the womb and healed or magnified before birth. So that kind of goes more into epigenetics. But think about this: when a woman is born, like even in the womb, that fetus has all the eggs she'll ever have in her entire life. I guess new evidence says that they do get a few more, but basically all those eggs have been exposed. And so, you know, that happened to your mom too. So what your grandma was thinking, feeling, what she experienced, your mother was exposed to and in the womb. And when your mom was a baby, her eggs were being influenced by what her grandma was feeling. So really what your grandma experienced affects you directly because you were there. You don't think you were there until you were born, but you were one of those eggs that was in the womb when your mom was just a fetus. So, I mean, it's kind of crazy. It goes back generations and generations. Yeah, it's crazy. Both positive and negative thoughts and our reactions, our neurological development. There's patterns that happen within family generations. And we can work with child development early on before the child's even born and preparing for birth. I touch a lot about that in my nonprofit, the Early Bonding Foundation. And there's a whole aspect that people don't know about in psychology called pre and perinatal psychology. And that's a whole other field, but mind-body connection, it's all there. Which leads me to the emotional issues that we need to address before we get into the body work, because you know, in a single day, a woman when she's pregnant, she can go from profound love, you know, feeling triumphant and excited, and then in the next minute, you know, thinking about having anger and fear and doubt and worry, and everything keeps changing. And seriously, everything changes. So not just your body, but relationships. There's a lot of stress and anxiety people don't talk about. And I guess I had once been told that anxiety is unresolved things from your past versus depression is worrying about your future. And that's why they go hand in hand, anxiety and depression. And this is something that is really best worked out during the pregnancy before a woman goes into labor, because when you're in labor, you shouldn't be thinking about anything. You should just be experiencing and having your baby and feeling your body and responding to it unconsciously. And thinking about things and worrying about things is actually what will slow down labor and cause pain. So it's a time when you really need support and you don't want to feel stress and need to work things out. So if it means going to a counselor or getting support from family and friends, as a massage therapist, you might be the only person that they can confide in and that are there to listen to them. And unfortunately, financial stresses is also an issue during pregnancy. There's a lot of things that you're going to have to pay for, and your health care, the provider and all that kind of stuff, but also like where are you going to birth your baby and how much does that cost? So there's a lot of cost to having a baby, and then, right? So if you look up how much it has to raise a child, it's kind of scary, but yeah, I forget how much, but it doesn't matter. It's a lot of money as far as like, you know, forget the newborn stuff, buying a crib and clothes and diapers and all that stuff that you need and baby proofing your house. But then like school and events and college and right. So all this stuff just is running through your mind like, well, I'm not growing up myself. How am I going to do this with a child? And you're carrying stress in your body. And maybe, you know, I mean, nowadays women work. Like in the old days, you could just stay home and concentrate about having a baby. It's kind of a good system when you think about it. But, you know, we want to be able to do whatever we want to do, but it's really hard doing everything. And and then a lot of times it's like a time when repressed memories can come out too, that you hadn't thought about in a long, long time. And basically, sometimes when the severity of an event was so traumatic, our bodies repress that thought because it's just too painful to think about it. And pregnancy is one of those times when all those feelings might surface. And, you know, they should be helped before you go into labor. Some statistics say that, you know, over 7% of women are affected by repressed emotions. And negative emotions affect the baby and can lead to drug abuse. It can lead to smoking, alcohol, antidepressants, and all those things affect the fetus too. There's actually a higher chance of violence during pregnancy than developing high blood pressure or diabetes. And about 17%, it's a pretty high number, 4 to 17% actually of pregnant women are reported to being abused during their pregnancy. I'm gonna just go over this and then I'm gonna take a break. So, and PubMed.gov has a lot of statistics. That's a good resource. And it did a report that said that 7.8% of women were abused in some way. And it might be even higher than that because a lot of times it's unreported. And the reasons were most of the time that it was an unwanted child. It wasn't planned. And other times it was because more attention now is being given to the woman than to the man or to the baby. And the man no longer feels like he's the center of attention, or she's too ill or too tired to take care of his needs. Sometimes there's financial abuse, forcing her to work more, or by refusing sex or making her feel like she's not pretty now or that she's bigger or fat, instead of making her feel like she's beautiful and powerful and amazing and growing a child. There might be jealousy feelings there. That is something that a man can't do. But so it's really important for them to get out of an abusive relationship and get support, or for some natural things that guys think about and they don't want to talk about. Maybe they should be talking to a good supportive person or a counselor to get help with some of the feelings that they're having that are normal. And they're worrying too about providing and supporting, and am I going to be a good dad, and all these things. So even really good, well-meaning, loving people go through a lot of emotions, and it affects marriages, and it affects relationships with friends. So your non-pregnant friends are going out and partying and having a good time. Or I know when I was pregnant, a lot of my friends were athletes in mountain biking and dangerous sports, and you know, like jujitsu or something. And like, you can't, you know, like some people do that, but I didn't feel comfortable doing it because I had lost some babies. And so like I was playing it safe and I didn't want to do those things. I didn't want to risk hurting my baby. And I felt isolated and alone while everybody else was off having a good time. And my friends who did have babies had children now, and they were really busy with their families, and they just didn't have time to hang out and talk because they were raising kids. So there's a lot of those things going on where we left off. So we're talking about the emotional issues and everything that happens with mom, and why does that matter? Because it affects the baby also. That's why. Tiffany Field, I'm not sure if you know who she is. Have you heard of Tiffany Field?
No.
No, she's a researcher at the Touch Research Institute in Miami, Florida, and she got involved with, originally with like $100,000 grant with Johnson & Johnson to study infants in the NICU and the benefits of infant massage that had great outcomes and helped the babies gain weight and leave the hospital sooner and save the parents money and all that. But she's got tons and tons of studies, a lot on pregnant women, but also just everything that is great for massage therapists to know, because it validates the importance of touch and massage and the effect that it has on our emotional well-being. But she did one report that said that when pregnant women experience stress, the levels of cortisol and norepinephrine surge, and they're sent to the baby. Levels of dopamine and serotonin are lowered than the feel-good hormones, and that leads the mother to experience a constant state of anxiety and anger. So, and it can happen in anybody when you have the low levels of those hormones, that you kind of live in that area. So that's not really good. And that also affects bonding. So it's kind of hard to bond with a baby when you're worrying about other things. And, you know, just bonding, like in this picture, begin when the baby's born, right? No, like bonding happens in the womb. And a lot of women can tell that even before they pee on a stick that they're pregnant. They just all of a sudden feel like, I think that was it. Like, I think I just got pregnant, you know, and they know at the moment of conception that they're pregnant and start bonding immediately. That relationship starts. So, like I said earlier, the hormones can cross that placenta barrier and affect the fetus as well. And so your work will affect the baby physiologically, structurally, and emotionally as well. So not just massaging the mom, we can enhance the bonding process by connecting the mother and the child through massage. So directly and indirectly, what the mother is feeling, the baby is feeling as well, right? And there's a lot of studies that show about like stress during pregnancy and the outcomes of the child. And I'll talk about those later, but I usually talk about those in the infant massage class. But I'm going to take a little bit of insight here. First of all, there is a lot more to learn, and I don't know what books that pregnant women are reading these days, but I know that when I was pregnant, all I heard about was what to expect when you're expecting. Like you don't have kids, but have you heard of that book?
Yeah.
Yeah, like I think everybody's heard of it. But have you heard of any of these other books?
No.
Right, so The Birth Partner was actually one of the books that I read when I was thinking about being a doula, and I was just blown away at the amount of information in that book. And then I did go to be a doula, and I started studying pre and perinatal psychology. The Pre-Parenting book by Thomas Verney, that I think everybody should read when they want to have a baby before they get pregnant. Or if they're pregnant, it's also good, but it's about how to nurture your child from conception. And there's questionnaires in there and everything, and it kind of explains why you are the way that you are, you know? It's a really interesting book. And then the attachment pregnancy is kind of the same thing, like how you can bond with your child while you're pregnant. Whereas the Ina May's Guide to Childbirth and Birthing from Within, those are more like the What to Expect When You're Expecting, but they're better. And I'm not trying to bash the What to Expect When You're Expecting book, but in the doula world, so they call it What to Fear When You're Expecting, rather than to empower you and things that are practical that you can do about it instead of worrying about things. So just different ways of looking at things. So the Doula Guide to Birth is also a really great book to read for both mothers and for support people. And so I'd just like to suggest some of those, and there's a resource file So I sent you some files in Dropbox, and anybody else taking this course who knows how I'll do it in the future, but right now I have the files in Dropbox. One way or another, you'll get it. And there'll be a sheet of resources that are recommended books, websites, DVDs or videos you can stream, blogs, articles, all that kind of stuff that are recommended if you're going to get into this field and you want to know more about it. All right. One of the things I learned along the way was after taking or reading the book, The Biology of Belief by Bruce Lipton. And he's also has a DVD, and that's really good. And there's some resources within your notes too about like where all this information comes from. But basically what it is understanding that the mother's environment equals the baby's environment, and the baby is going to see and feel and react just like the mother does. And it actually can affect the brain development of the baby. So in studies, they studied rats in one of them, and I think monkeys in another one. But what they found was that you can actually change the development of the brain, and parents are almost like genetic engineers in this fashion, that if you have a supportive and nurturing environment that the baby's living in the womb, right? All the good feel-good hormones, and you feel safe and nurtured in your relationship with your partner, and you're not worrying and all those kinds of things, that you're actually going to be in a state of growth, and the baby will develop a bigger forebrain. Versus if you are in a constant state of protection, your body goes into that fight or flight stage where you can't really protect yourself and grow at the same time. So like say when you're stressed out, it's almost like as if you're being chased by a lion. Your body's natural reaction would be all your blood rushes to your extremities so you can run away from the thing that's chasing you, right? So none of the blood is in your organs or your brain. It goes to your extremities so you can get out of there and save yourself. So what happens then is you have a bigger hindbrain. And so these animals, that rats in the study, they had a bigger hindbrain and bigger body musculature, but they were kind of shortchanged and the forebrain was smaller. So when your forebrain is more of your intelligence, your thinking part of your brain, your neocortex. And so if we really want to help children succeed in life, we want to have them in a nurturing, supportive environment, which means we want to make sure mom is. Because if mom's stressed out, baby's stressed out. And if mom is stressed out all throughout her labor, it's going to mean that this baby is going to be born with smaller musculature, or bigger musculature, but smaller forebrain, and they're going to have maybe learning developments and problems in life. We see correlations with everything from ADHD to learning problems in school, poor motor function. And the good news is you can get that back in a lot of ways when you get that baby into a supportive, nurturing environment after they're born. But it's so much easier to not have that developmental delay and be born with everything that you can, right? So it's not enough to have the DNA or in the genes. You have to be nurtured to produce those brain connections in the baby. So let's take a look at this. Hopefully it'll play. This is a sonogram that captured the baby when the parents were having an argument and the baby's reactions. So I'm going to play it and you can tell me if you think this baby is aware.
Basta! Mi hai stufato! Non ti sopporto più!
Non urlare,
Insomma, basta!
Quando un bambino nasce, ha già un passato. Siete voi. Non dimenticatelo, perché 9 mesi valgono una vita.
It's scary, huh? I mean, we don't think about these things. And so that's why I say that, you know, it's not just mom on the table. And You can really influence a person. This is Bruce Lipton, and what he says is that, you know, it's like nature's Head Start program. It's actually a good program. It's developed so that the baby, when it's born, can survive in its own environment. If the baby was like all nurtured and then was thrown in there, it couldn't handle the stress of what's going on. So the body develops so that it can survive and function in that atmosphere. And he says that you can actually shortchange a child's intelligence by 50% by living in fear, right? So sometimes, you know, I've been to places and I think it's a good idea to have maybe a sign on the back of the door or on the back of the door of the bathroom or just on the countertop of, you know, like, if you're scared or abused, here's a hotline number you can call. Or here's a list of counselors in your area that specialize in this. And, you know, if you want to talk about this, you can, you know, call or whatever, this number, email this, and I'll know it's you, or, you know, what it's about and get you help. Something like that. But yeah, a lot of people don't talk about it, so we need to make sure everybody's safe. Unfortunately, a lot of those women don't end up coming to get massages, right? But yeah. All right. So the good news, so that's kind of depressing, but the good news is that many women do have reduced stress reaction to stressful events during pregnancy. Their brain actually changes, as do the hormones that are produced, which actually enable you to deal with stress better than you could normally. So mothers are designed to be calmer and gentler and more loving and nurturing as a result of pregnancy. And it's actually a friend of mine, Susan Highsmith. She's got her PhD in pre and perinatal psychiatry, and she talks about in this book the renaissance of birth and how things changed over time and how to create bonds that last a lifetime, and how just picturing in your mind's eye or on paper how your thoughts and your imagination, those things, how those can actually affect even like the words that you say, like affirmations and things like that. They actually work. It's not a silly psychology trick, but I know when she was said in the book, when she was doing this experiment, she would visit with pregnant women and have them draw a picture of what they thought their birth would be like, interview them, and then she would meet with them again after they had their baby, and then would look at the picture and see if there were any correlations, and found out some interesting things that, like, say they drew this birth scene, but they didn't draw a mouth on their face. And then later they said, well, I just felt like nobody was listening to me. I had no voice in the matter. Or like didn't have legs and it turned out they had an epidural and couldn't walk. Or maybe they said during the interview they wanted a water birth, but in the picture they drew like a really big bed instead of like a hospital bed or something. And then they, like when she talked to me afterward, they labored in bed. Like somebody said they have their family around, but in the picture they drew, there was just like one person, and they said that they wished the people could have been there. Or every picture that was drawn, which instead was like a labor scene, was like mom and dad and the baby together. Those people ended up having C-sections and didn't actually go through the labor process, which is really kind of interesting. So then she did like an experiment of drawing what your ideal birth would look. And if she saw the picture and noticed those things, she'd be like, well, why don't you draw this so that you make sure that you have a voice in your birth? And if that's what you want, you make sure you put that in there, and kind of put the interview words in with the picture and actually saw the outcomes better. So words, thoughts, all those things with birth preparation are important. And I think that there is a difference between going to, say, a hospital childbirth education program where they basically tell you, here's what you can do for pain. This is our birth floor. This is what the rooms look like. You know, maybe a little bit about nutrition. You know, who knows, they might be better now, but versus say a Bradley education, childbirth education class, which is like 12, 13 weeks long. And they go through repeatedly comfort techniques for labor. The partner or husband, whichever, is involved in this process, and they practice the techniques over and over. So when labor comes, it's not something you have to think about. You just, you know it, you learned it, and you're going to react to it and do those things. Those types of classes seem to have better outcomes for easier labor, a better birth, and happier babies, and better bonding and attachment with mom and baby. Robin Grill wrote, I like this quote, "It's clear that many complications during pregnancy can be eliminated when mothers are empowered, reassured, and supported by people who are trusted and familiar with, and whom they're familiar with, and whom they feel safe." So I should have read that instead of like reading part of it. Oh yeah. And it's also nice to have some handouts for lifestyle recommendations, things that they can do, maybe not all at once, but maybe if they're coming in twice a month, once a month, whatever it is, it's great if you can have a little something like a little index card or a quote, or send them a text or something with something they can do each time. So one of them is to identify a support team, either your partner, friends, family, clergy, other trusted support individuals, or all of the above. Get professional help to go over any unresolved trauma or serious emotional conflicts. Get regular, appropriate exercise. Increase sleep, rest, and naps. Ensure excellent nutritional intake. Take childbirth education classes, learn, read, and research about pregnancy, labor, and birth. Meditate, pray, or do yoga to connect with spiritual realities. A lot of times in labor, people get very spiritual for the first time. Schedule regular massages for you and your partner. Okay. And then I did want to mention a couple books. Let's go over here. This is another one. Let's see if it will. No, it doesn't. Okay. You kid yourself. All right. Can you see me on here?
Bring it up a little more.
Can you see me now?
A little bit.
Okay. Well, it's
That's better.
Nancy Gore's Thinking Woman's Guide to a Better Birth. And this is great because there's a lot of studies and research articles that are in this book. So if you're one of those people who are like, I want to know the pros and the cons about this and decide for myself, that's a great book. So I just want to mention that one too. And I would also highly suggest watching The Business of Being Born, or Orgasmic Birth, or Pregnant in America, and try to watch some natural birth videos. There's a lot of DVDs that are on the list that are really good and explore childbirth. And there's a lot of stuff on YouTube, but you just never know what you're going to find there. So look at my resource list and watch some of those so that you can see what you like and know what they're like so you can recommend them to other people. But I think all we see these days are well, there's another one called Laboring Under an Illusion. And, but I think when you're pregnant, if you, all you see is this chaos on sitcoms and they have the baby before the commercial break, that you start to think that that's what's going to happen. Your water breaks, you got to rush, it's crazy, you know, and it's just not like that. So watch some good experiences and get that in your head. Have that picture in your head of a woman, powerful, glorious, having, you know, these intense labor, but just this spiritual experience and having a beautiful baby and the bonding experience and the whole family together. That's a better image of getting that in your head than watching chaos and, like, you know, the ER things on TV and those reality shows are just crazy. I think the biggest thing that we have a problem with pregnancy massage is people wondering if it's safe or not, or how to be safe. So that's this section. I'm going to talk a little bit about the history, the research, complications, and just precautions and all the contraindications when, because there's a time when we can't do it. It's not like always it's okay and safe. So there are times when we need to know what those things are. But pregnancy, in a nutshell, in my opinion, it's like if you were healthy and didn't have any problems before, you shouldn't expect to have any when you're pregnant. If you had a physical or physiological ailment, like if you had diabetes and high blood pressure and issues like that before you got pregnant, then you like might have some issues and some contraindications or certain precautions that we have to keep in mind during your pregnancy, and that might relate to massage or labor and those kinds of things. But a healthy person usually good to go, especially if they were accustomed to getting body work done before they got pregnant, you know. So, okay, so history, basically like massage in itself and every other modality, it's been around for thousands of years. There's actually evidence of that and references in Ayurvedic medicine texts, which recognize the need for mental and spiritual and physical preparation for mother to be, for childbirth. And the texts refer to rubbing pregnant women with oils throughout pregnancy as well as afterward. And many cultures have their own traditions and rituals regarding pregnancy massage. And many of the traditions involve those midwives and other women by doing massage and helping mothers in that way. There's evidence in Asian and Jamaican and Hawaiian and Native American and Latin American and European cultures, all of them, some form of massage was used, and usually with healing oils during a woman's pregnancy. How are we different from other countries? Most other countries, they use midwives for a normal childbirth. So like I said, if you were healthy before and you didn't have any issues with your health, you'd see a midwife. Some of those midwives might be in a hospital and some might be at a home birth, but you would see a midwife would be your medical professional. OBs, like obstetricians, or OBs for short, they are only reserved for high-risk issues. Whereas the United States, 98% of women have their babies in a hospital with an OB. Other countries, a lot of children, they grow up seeing births in homes, and they know about childbirth and how babies are created and born. And they're actually present when their sibling is born, which can help with, you know, sibling rivalry and this and that. And most women learn about childbirth from, you know, these classes, and other women, where in the US, 88% of those classes are taught in a hospital with childbirth education programs. So, like I said, there's a lot of those documentaries out there, like The Business of Being Born, which talks about those kinds of things. And then there are these pioneers in the field that wanted to talk about. Penny Simkin, she wrote The Birth Partner. She's got a lot of videos. She actually was the first one to like start DONA, which is Doulas of North America. And then Marshall and Phyllis Claus and John Kennel, actually, Dr. Claus was a neonatologist and Dr. Kennel was a pediatrician, and together they did a lot of contributions in this area. So it's been, I think, almost 40 years now that their research was basically relating to bonding and attachment, but their work examined the mother-baby relationship and the first contact with mother and baby. And Dr. Kennel, I believe, was the first one to say, hey, mom and baby should not be separated. Prior to that, they would take the baby away and put the baby in a nursery. And there was some effects of that. Like, he noticed that the babies were hungry and ready to nurse right away. They had that rooting reflex and would cry to be fed. And we found that because trouble bonding with the baby, when mom and baby are separated, there's a lot of issues. This is my internet connection's unstable. Oh, it went away. Okay. So, but basically that when mothers have continuous emotional support and physical support during labor, that there were better outcomes, not just for the mother's labor and birth, but the bonding and attachment between the mother and baby and between the mother and her husband. She looked at him better, and the father actually would bond with the baby as well and look at the wife better, all just by keeping mom and baby together and supporting mom through labor and being present and not having her worry during labor. Well, so we were just talking about supporting mom and baby during labor. It helps with bonding and attachment after. And all the studies that Kennel and Claus did. And then actually Phyllis Claus, she was a counselor, and she specialized in the perinatal period also for 30 years and consults nationally and internationally, and is the co-author of a book called Bonding and the Amazing Newborn and the Doula book, all those kinds of things. And so the Kennel and Clauses, along with Penny Simkin and Annie Kennedy, they chose the word doula to describe a woman who serves other women, and founded the company DONA. And all their research and books influenced Carol Osborne Sheets, who started the first training programs for massage therapists in pregnancy massage. And she wrote the pre and perinatal massage textbook, which is a great resource for massage therapists. Highly recommended. It breaks everything down. And that's who I got certified through. So great respect to her. And just I'm going to add a little bit more, not replace it. So let's see. Penny Simkin, like I mentioned her, being a physical therapist, she had come up with a lot of ways to do comfort measures during labor and support a woman, and doing these kind of contraction distractions. And so those are some really great things that I'll share with you during the labor portion. And she wrote comfort measures for labor, a great video DVD, and the 3 R's, which relaxation, rhythm, and ritual, and how you can help women in pregnancy. And these are all great pioneers who've really affected perinatal massage and bonding and attachment. Frederick Leboyer and Michael Audin, they also did a lot of studies. You might hear of the Leboyer method. there's the water birth. He kind of made that popular, birthing your babies in water, and the newborn running. You might have seen those videos on YouTube or Facebook or whatever, where they're taking the baby and running the faucet over the baby and having them be in water after birth to recreate kind of a womb atmosphere. A lot of that research came from him. And I've taken several courses by Michel Audin in the past, talking about cesarean section and what it does with the processing of organization, with the way that you can handle stress and bonding and attachment and separating mom and babies and all those kinds of things. So he's also a really great resource, and I love his book called The Scientification of Love. If you want to be radicalized, that's one of those books. And it just kind of talks about how we can have an easier birth and actually an easier orgasm if you have problems with that. There's a lot of correlations between what got the baby in to what gets the baby out, and how to do both in a very, I don't know what the word is, but an easier way. So, yeah. And I already talked about Susan Highsmith. I met her actually through Gladys McGarry and the Foundation for Living Medicine. And they have a loving birth section within that foundation that I'm on that committee. And so I worked together with them, and Gladys McGarry is coined as the mother of holistic medicine because she kind of coined the term, and she was the first one in Arizona to get men in the labor room to be present along and witness the birth of their child. And just an amazing person. And a lot of that is based on pre and perinatal psychiatry again. So just want to mention that. There's a lot to learn there. And then a lot of the animal studies that were relating to pregnancy and what we know these days were done in the 70s. You might recall Harry Harlow and the monkeys, which they had the wire monkey that didn't have food and a cloth monkey that did. And the baby chose the cloth monkey without food. It chose comfort and warmth over food. That the need for touch and skin sensation was more important than food. So, and Ashley Montague had the Touching Bible, everything to do about touching. Basically, all these, and James Prescott has like Origins of Violence is another thing that it all comes down to, that touch is the only sense that we cannot live without. And that if we aren't touched and have nurturing touch and love, that there's grave consequences for that. People tend to be more angry and violent and have developmental delays. They've seen it in the orphanages, in the, very early on, where the kids were just like, their diapers were being changed, they were given a bottle, but they weren't like talked to and with compassionate communication, and they weren't touched and loved and held, and there were severe developmental delays. And they would have typical rocking type behaviors, almost like autistic behaviors. And we actually see some of those things too, correlation, and talk about those during the effects of like the smartphone and not having eye-to-eye contact with our children, and the problem with that. So, but we did see that when like these animals were massaged and touched and even talked loving to, like they had some rats that were spoken nicely to, and the other ones were treated coldly. The ones that were treated nicely and talked to and petted actually bonded with their rat pups and bonded and had healthier births than the ones that were treated coldly and weren't touched at all. Like they sometimes ate their babies and killed them and ate them. So, but we also see the ones that survived were more anxious and clumsier and sicker and shyer. And when they were neglected completely, they became more aggressive and violent. So there's a lot of information in those resources as well. So I could talk for like 3 more days about this research, but I'm not going to. Tiffany Fields, like I mentioned before, these are some of the outcomes of pregnancy massage. So this was huge. After her studies, that pregnancy massage actually lowers blood pressure and slows the heart rate and assists in the mother's ability to take care of the growing baby. As blood and lymph circulation increase, the work of the heart is supported. The more blood and nutrients are sent to the baby, and the circulatory system is supported, then edema and heaviness in the legs and feet are reduced. A typical maternity massage therapy session can address physical challenges, even gastrointestinal discomforts. Even though you're not working on the intestines per se, you still affect digestion by releasing food absorption hormones like insulin and things like that, and affect postural changes, taking the musculoskeletal pain and those discomforts away, like low back, pelvic pain, and the hips. So there's a lot of things that massage can do, but also involved with that is, like it says here, decreasing anxiety and depression. It increases the parasympathetic response. It decreases adrenal stress and hormones. So like cortisol and norepinephrine. Some studies show that when high levels of cortisol are released in the womb, it can lead to obesity later in life and bonding problems. It increases the systemic and local blood circulation and heart rate and blood pressure, like I mentioned. It provides emotional support and physical nurturance. Experience of loving, nurturing touch encourages the pregnant woman to also touch her own baby. And when you touch a pregnant woman, it encourages the spouse to touch the pregnant woman. And even some of the studies, the spouse was doing the massage. So it helps to relieve spasms, cramps, and myofascial pain, develop sensory awareness when trying to relax in the first state of labor. It encourages the ability to recruit appropriate muscles during the second pushing state of labor. It decreases premature births, so we have babies staying full term and not having to stay in the hospital in the NICU and being separated from their mother. It improves the outcomes of labor, and it decreases the use of medications and use in labor, including epidurals. You have somebody who knows right where to support and put their hands and take the edge off of the labor pains and be supportive, letting them know what's normal, what's not normal, and that they can do it, and being kind of a coach as well. They don't need the medication, and the medication doesn't affect the baby, and that doesn't affect the bonding and attachment then. So decreased number of cesarean sections as well. And the baby is actually going to have better APGAR scores, and all just from getting prenatal massage. So that's pretty cool. What else? In a rat research science thing they did recently, oh no, that wasn't recent, that's in 1963. That's when they prevented rats from licking themselves and doing self-stimulation. They actually had poorly developed placentas and developed 50% less mammary gland development. And the babies were born ill, stillborn, or died after birth due to poor mothering skills as well. Just because they didn't have skin stimulation during their pregnancy, that was a result of all those things. So if we know that if we do stimulate the skin through massage, that we could have a healthier placenta and better milk production and all those kinds of things that we don't really even think of. It's not just the structural skeletal stuff. Real popular study, this is one that's easy to remember. Tiffany Field took 26 pregnant women. One group got prenatal massage and the other group just had relaxation therapy. And it did benefit both groups. They felt a little less anxious and less leg pain. But only the massage group reported improved mood, better sleep, less back pain, They had decreased stress hormone, cortisol. They had fewer complications. Fewer infants were born premature. And then she worked with depressed mothers and found that the fetuses of depressed versus non-depressed mothers were also more active during the 5th to 7th month, resulting in the mother's stress level and finding, well, it served to model this in other things here. So let me just put this on here. Okay, in the study, the massage was actually provided by the significant other. They got 20-minute massages twice a week for 16 weeks. And they found that it decreased depression and anxiety. It lowered their cortisol levels. The pregnancy outcomes improved. And there were less premature births by massaging these depressed mothers. And then with really bad depression, this major depression prenatal study, the women had reduced depression period. They also had reduced depression and cortisol levels during the postpartum period. So even massaging a woman during her pregnancy, it carries over postpartum. And the newborns were less likely to be born premature. And the newborns also had lower cortisol levels and perform better on their Brazelton neonatal behavioral assessment scores. And this is Penny Simpkin. And she said that massage can not only enhance a way a woman feels as she goes through the childbearing year, but also how she will look back on it in the future. And you will be remembered for years to come. These were some studies that were done on the efficiency of pregnancy massage. So when they studied Swedish massage specifically, it showed that it can facilitate gestation by supporting cardiac function, placental and mammary development, and increases cellular respiration. When they studied deep tissue, trigger point therapy, both active and passive movement massage, it showed it alleviated stress on the weight-bearing joints and myofascial structures, especially on the sacroiliac joint and the lumbosacral joints, and on the lumbar spine, hips, pelvic, and spinal musculature. Structural balancing and postural re-education, so some of the stuff we were just touching on before, does help to reduce neck and back pain caused by improper posture and strain to the uterine ligaments, which we're going to take a look at in a sec. So stress activates our sympathetic branch of the autonomic nervous system. You might find that short-term stress is actually good. You find that somebody who's got a lot of short-term stress, but then they get over it, back and forth, they never get sick. They're really healthy, their body works great. It's meant to work short-term, but it doesn't work good long-term because you get all of the vasodilator constantly, you have more adrenaline running through your body and you're more alert, but you can't keep that up 24/7. So in an emergency, that can be a benefit, right? But chronically, it has a negative impact on the childbearing development. Like I said, the adrenal glands go crazy, right? And you're in a constant state of fight or flight response. What the mother feels, the baby feels. And that cortisol, noradrenaline, all those things can affect the baby. And it can affect the baby's respiratory, the lungs, all those kinds of things, brain development. So we can't have long-term stress. All right. Severe stress can also affect pre and perinatal development. It can increase your heart rate, your blood pressure. It can cause vomiting. It can cause nausea. It can cause a spontaneous abortion, toxemia, and immune system dysfunction. So pretty serious stuff. So that causes like a slow birth rate, and then you can have a premature baby too. Or a baby that goes full term, but is small for gestational age. The newborns of depressed mothers, I have high cortisone levels and low serotonin. 13% of those babies are born prematurely. Because they're born prematurely, they're hospitalized and spend time in the neonatal intensive care unit for 2 to 5 months, right? That separation can change. Like some moms, if that's their only child and they don't have to work, can spend 2 to 5 months staying in the hospital. But most people have to work, or they have older children that they have to tend to. They can't just abandon their other children. And at some point they have to live their life. And that means separation from baby, and can cause all kinds of depression, bonding issues, developmental delays, both physically and mentally, can cause marriage issues and divorce. It's, it's huge. So can cause later in life with those children as they grow behavioral issues and learning disabilities, and the need for interventions and more money involved for those interventions. And so massage therapy really could be an intervention to help that. And to, if we can get mom some help and have her supported and help her emotional health, not just her physical health. And sometimes just a massage can help lower your blood pressure, get in that relaxed state, listen to the music, even if it's just for an hour a day, that can really help. And then if we have resources, we can help that are beyond our scope of practice. It's not that we're talking to them about these things, but we're getting the help if they need it. So we need to be aware of these things. And then just a little bit of the disparities. So some statistics show that Black women actually have the highest prematurity rate over all other races. They're actually 9.7% higher than any other race in the United States. There are 50% more white women, 25% more than Hispanic women. And the outcomes have been relatively unchanged for decades. So this is actually, if you want to work with a group of people, they need a lot more support. Catherine Nuckols did a study proving that women who have strong support systems have the complications of women with similar stresses that don't. So it's not that we don't have complications. And provided positive physiological and emotional outcomes. Obviously, they had the better scores. And Mike and Nancy Samuels, in 1975, a book, Seeing with the Mind's Eye, came out and explored visualization in pregnancy, combined with massage to help during labor. They wrote the Well Baby book and Tips of Caring for Your Newborn from Conception to Age 4. And in 1996, they did a study of the effects of stress reduction and massage support, and showed that it activated the parasympathetic branch of the autonomic nervous system of the expectant mother, and how those hormones can bathe the fetus. And that's kind of repetitive what I was just saying, but massage can make all the difference. And then this slide's just about epigenetics, which I just mentioned already. So I won't go too much into. There are long-term effects of birth trauma. It's multi-generational. Our environment and choices affect gene expression and are transmitted to children grandchildren, and then subsequent generations. And this is something that affects as well. So preconception, 49% of the 6.6 million pregnancies a year in the United States are unintended, right? That's a huge number. 51% of all pregnancies in Arizona were unintended. Teen pregnancy rate in Arizona, 60 out of every 1,000 are higher than the national rate of 57 per 1,000. So in Arizona, we actually have a problem with teen pregnancy versus any other state in the nation. So we need to work on that. What they have in common here is they were unintended. So there's a difference between being an unwanted pregnancy versus unplanned or mistimed. So if something was unplanned or mistimed, we can still bond with the child and help that woman. But if it was unwanted pregnancy, that entails a huge risk for negative psychosocial development and a mental well-being for that child. So there's a bunch of stuff in the notes on how you can get involved and all that to help out. Other cultures versus the United States. The WHO, because of COVID, now everybody knows who the WHO is, but the World Health Organization, they actually ranked the United States second to last in maternal and infant mortality. Yet we spend billions on pregnancy and childbirth related care, more than any other country. Women are 70% more likely to die in the United States than in Europe. 99% of our women have babies in hospitals. In 2012, the C-section rate was 32.8%, and a third of those got episiotomies. And that hasn't changed. But we are superior at saving premature babies. The Netherlands, Sweden, Denmark have the best outcomes. And the vast majority of countries get individual support from a midwife, free to move about during labor, birth in any position they want. They're rarely induced, anesthetized, or cut. 14% C-section rate, and have 20 to 30% have their children at home. So I'm not going to lecture about that. Those are just statistics that are real facts. So I think, like, what is normal childbirth? How do we get an idea of what normal childbirth is? And what do we have in our head, in our mind, before we go have a baby? What do we know? And we hear stories from other people. On sitcoms, reality shows, how often do we watch those versus watching a natural birth video or a documentary about a natural birth? So information is key. There are a couple of videos on here. One's the cone heads and about like the breaking of the waters, which is kind of a misconception. And then that one's kind of funny. And then and there's another clip I have.
Yes.
Okay, so I just, put in here, this is kind of the reality, like, and we'll talk more about it during labor, but what usually should happen is that you're resting before you go into labor. And once you're in labor, you want to, like, that's why they call it labor. You're going to get up and work. You're going to move around into whatever intuitive position the baby makes you get into so it can get through the birth canal and be born. And you go through contractions, and that's normal, but it's all bearable. And But a lot of times women will go and they'll walk and try to induce labor by walking up and down stairs or walking the mall and eating things and whatever. And then when they actually do go into labor, they're so tired that they don't have the strength to go through it, and then they feel more pain, and then they end up getting an epidural and they look like the lady in this photo. Or they've just heard, like I said earlier, like, oh, why would you do that without an epidural? And that's the first thing they do is when they get into pain. And they think if it hurts this bad at, 2 centimeters, what's it gonna feel like at 10? I want an epidural now. When really it doesn't ever get any worse because your endorphins and everything else kicks in. And if you're supported, it's normal, you can get through it. But, so then they go and get an epidural and not even consider the side effects of it because they'll say, yeah, it's safe. Everybody walking around has had one, so you can have one too, and you believe it. But there's a lot of stuff that goes with it that, I'll talk about later, but, it's kind of hypocritical, I guess, that, I can remember standing in line in Starbucks pregnant and somebody giving me like the stink eye and saying, like, you really shouldn't be having coffee when you're pregnant, which now a cup of coffee is actually okay. Even 2 cups of coffee is okay, they say, with caffeine. But, back in the day, that's what they would do. But, they're maybe not having even a Tylenol or, eating perfect and whole foods and organic, and they're doing all this stuff all throughout their pregnancy. But then on the very day that they're going to have their baby, which is like the most important day, they get a slew of drugs more powerful than, morphine. And that goes, they say it doesn't affect the baby, but it does. It affects bonding and attachment, and affects tearing, and affects, all kinds of things. So, it shouldn't be the first thing that you do. There's a time and a place for everything. But I don't think anybody just like even gives it a thought, like, doesn't even consider that, So it's just an awareness, and that, like maybe if you had one, like you'd be like, oh, well, I had one, and you're telling your client and sharing information about yourself, which, that's an ethics class about, how much you should share. But, you could affect what they do. And that's the reason I include it in here, because it's more getting them the facts and research and what books to read and what videos to watch, because they will ask you questions. A lot of times they're not just laying there because they're anxious and thinking about everything that's going to happen. So let's talk about the good stuff. I gotta get all the bad stuff out of the way. So we can break down the benefits of into the physiological, the structural, and the emotional, just like, talking about how massage affects. And then within each one of those things during pregnancy, during each one of those things during labor, during each one of those things during postpartum, the adult child, the lifetime effects of massage in each one of those aspects. And then also how it affects mom, how it affects the baby, how it affects society in general, and how it affects the partner or, the other parent of that baby. So those are some ways that we can categorize and then pull those out of our brain when we're trying to market ourselves later. So the physiological things were those hormonal, respiratory, gastrointestinal, urinary, physiological processes. And it helps reduce edema and blood pressure and release varicose veins and increases blood and lymph circulation. The structural benefits would then be how it reduces musculoskeletal pain and strain and contributes to developing a kinesthetic awareness and flexibility and preparation necessary for active birthing, so that through massage, they're actually going to learn where they're carrying and holding tension in their body. They're going to learn about their posture and how it affects that. Whether they need to stretch or tighten tight muscles, or strengthen the weak ones. Instead of waiting until finding out during labor where you need your strength and where you need your energy to be focused and not being distracted by pain and strain. So, of course, during labor, we can have somebody there as well. And the emotional benefits that massage has is it actually helps reduce stress. So there are a lot of studies on that it promotes relaxation through emotional support and physical nurturing, and it gives you more energy and increases mobility and reduces joint inflammation. It improves posture and relieves pain and improves muscle tone. And also, like, women worry about stretch marks, and just having like massage lotion over the belly will help moisturize and nourish dry skin and alleviate those stretch marks. Massaging the baby during the final weeks of pregnancy, the unborn baby, it's still in the womb, is gonna react to the stimuli. That's one of the things that really got me into doing massage, was doing my first baby massage and a pregnancy massage. As I'm rubbing my hands around her tummy, the baby kicked back at me and responded. And it was almost like playing with me and following me around where my hands went, and was like reaching back out at me and leaning into it like a cat leans into a pet or a dog. The baby was leaning its back into me massaging the mom, and it was time for the baby. And I was like, this is so cool. I just can't even believe this. And I got into pregnancy massage and wanted to get certified in it. And that's why I'm teaching this now. So, and then during labor, so all the studies show that massage actually contributes to a shorter, less painful labor. And in the postpartum period, it improves infant well-being, and it fosters nurturing maternal touch. And for our society, and it encourages a more loving and less violent individuals in societies. So less tech, more touch. So in conclusion, all current research indicates that massage therapy positively counteracts the negative effects of stress and encourages the mother to create a physical and emotional and mental environment that's supportive of the healthy and timely development of the baby. And this modality of prenatal health care should be a necessity for each and every pregnant woman. And I know that even in labor massage, if you're there attending and doing massage with the mother, then that actually encourages the partner to touch the mom even more too. They'll see what you're doing and they want to do it too, because they want to help and fix things. So it actually helps with the relationship between the couple. All right, let's look at some of the things people worry at, the general precautions and contraindications. So let's see. Here's some considerations. Again, it seems like a long list here, but I think it's important to work with a care provider as well to determine what's appropriate and safe during pregnancy. If any of these conditions exist, if they don't exist, I have an easier chart to follow coming up, but usually cramping isn't a good thing. If there's pelvic and abdominal cramping and pain along with it, that's sustaining, that you should really turn them away and consult with a healthcare provider. I don't think they'd come in for massage if they were experiencing a lot of these things anyway, but just, you know, kind of FYI. High blood pressure, swelling of the hands, the face, or the legs in the first or second trimester, which also could be postpartum as well, could be a contraindication. We'll talk about those separately later. Any kind of vaginal bleeding or leaking of fluids. Did I pause again? I just had it, okay. Said it was unstable. Severe nausea and vomiting. A little nausea or a puke here and there, okay, but if it's really bad hyperemesis, like severe morning sickness, they should be seen. Severe headaches, swelling, pain, heat, and redness in the legs, bulging, discolored, or painful veins in the legs, leg pain or swelling in both of the legs, if there's an abnormal fetal heartbeat, lower back or inside thigh pain or pressure unrelieved by position change or activity, severe anemia. Some would say that massage is contraindicated, but it's more of a consideration. You don't know until you talk to the healthcare professional. I probably wouldn't until I talked to the healthcare professional. The mother's age. So it used to be that they would say that if you're over 35, but that's not really the case. They kind of extended it to 40. End would be 15 and the upper end would be 40. But age is just a number. So there's some people that are older that aren't as healthy as like, or vice versa. There's some older people that are healthier than younger people. And, you know, so, but there are some things that happen after the age of 40 with their eggs and things like that, that it can be high risk for Down syndrome and all that kind of stuff. So age does matter in certain things, but not specifically to massage therapy that you would cause some sort of problem with the birth or with the baby by something you would do. That would be a, you know, chromosomal thing or whatever. But so age means that you want to probably consider working with the care provider. If they have diabetes, cardiac, liver, kidney, any organ dysfunction, if they have hypertension, toxemia, asthma, or pulmonary disorders, if they test positive for Rh negative blood type, we'll talk about that in a little bit, drug exposure, genetic disorders, if they've had a previous high-risk pregnancy, multiple babies in there, twins, triplets, or more, placenta previa, no prenatal care has been had and they just come into you, obesity or eating disorders or low weight gain, sexually transmitted diseases, and lifestyle risks such as smoking, drug, or alcohol abuse. These are all things that they definitely should be seeing a care provider for. And then I'm going to show you this chart here. These are like considered high risk things for you. So we mentioned those things, but here's on this chart as well, specific. And so it's a little smaller of a chart and easier to read. And then I'm going to advance to the next slide here. So this shows, and I don't know if our pictures are going to be in the way here, but I'll read them, I guess. Let's see. So placental abnormalities. They may have been told they have placental abnormalities, or they might not know. The symptoms of placental abnormalities might be bleeding or cramping. Intrauterine growth retardation or small for gestational age. That means they are on track, but the baby is low weight gain and small size for where they should be at that moment. And they're decreased fetal movement. So there should be so many movements. And if they're not having any movement, they need to be seen. Pregnancy-induced hypertension disorders, including hypertension, preeclampsia, and toxemia, related to high blood pressure would be a symptom of like what causes that. It would show up when you pee in a cup at the doctor's office. They're looking for protein in the urine. But as a massage therapist, maybe they have mid-back pain. It's pretty common to have low back pain, but if they have constant mid-back pain, it could be related to hypertension. So that's something to consider. And then gestational diabetes. They'd be looking when you pee in the cup for sugar in the urine. signs of that are frequent urination, which can be kind of tricky if you're pregnant in the first trimester and then again in the last trimester. You might have to go to the bathroom all the time anyway. But in the middle trimester, if you're going all the time, that's not normal. That could be a sign, unless you have a pelvic floor issue, and then like it can get complicated. So it's kind of just things to consider. Another sign of it would be excessive hunger and thirst. So those are signs that you could have diabetes, or you're getting diabetes, or those kinds of things. There is a book called When Pregnancy Isn't Perfect. It's a layperson's guide to complications in pregnancy by Lori Rich. And so you can have it on, you don't have to be knowledgeable about everything. You might forget, but you'll see a pattern of things, and you're normally gonna see healthy people, but if something comes up, you could look it up in the book and say, look up a symptom and it'll tell you. And there's also in the pathology guide for massage therapists that you can look up different things and see if massage is indicated. That's also a great book. If somebody's high risk, the practice implications for that, you may still be able to work on them if they're high risk, but we want to avoid any kind of abdominal work. We want to avoid the legs and go back to the old conservative, just working on the back and neck in a sideline position only, and preferably the left sideline position because that gives optimal output for circulation. So we just want to avoid those areas and then consult the doctor. So maybe you don't have to turn them away completely until you get more information if you had it scheduled. The inner thigh can be a dangerous area for a massage therapist. I know when I first started, I got like a continuing ed video where they were doing Rolfing and they were doing the inner thigh and they were just taking their forearm and just stripping and going up. And knowing what I know now, I think like, that could be really dangerous because women have blood clots in their inner thighs. You can see the great saphenous vein there and how it goes down the middle of the thigh. And with the weight of the uterus and blocking across the inguinal area, that it gets blocked and there's not as enough circulation going through there. And women develop blood clots in their inner thighs. So if you go through and you break one of those blood clots loose, it could be a pretty dangerous situation. And it also can cause, like the lack of circulation can cause edema in the legs and all that. So the inner thigh is a great place to do really light effleurage and get a lot of circulation going in there superficially. And we just don't want to do any deep pointed or elbows or forearms and those kind of deep things that could release a blood clot or worsen breaking lymphatic vessels and worsening the lymphatic, and then the edema gets really bad. So, and then it takes 24 hours for that to replenish. And so the inner thigh, it can be worked. It just needs to be worked light and more circulatory and lymphatic drainage work rather than a deep tissue thing. And there are some stretches that we will learn for the inner thigh that will help stretch those muscles and work them without having to massage them. If you do notice swelling, like one of their legs is significantly more swollen than the other, or they have a lot of pain and tenderness in their calf or thigh, that could be a sign of a blood clot as well, or other serious conditions. So just be aware of that. The leg should be the same size. And if you notice swelling in their face or really puffy around their eyes, more than slight swelling in their hands as well, and or
So if it's excessive or if it's sudden that the swelling comes on in the feet and ankles, that actually could be a sign of preeclampsia, and that's a really serious condition. So that's just some things that while you're there you can look out for. There's just like one of those little thought things. So what signs can you help, or what signs can help you distinguish normal prenatal back and pelvic pain from that associated with a miscarriage, a preterm labor, or other visceral imbalances? He says, I don't know. So I guess what you need to look at is, are there any other symptoms? Are those complications like the bleeding, amniotic fluid leaking, abdominal cramping, are they having any contractions? Are those things present? And does a change in activity in positions relieve the pain? So if it does, if they're having like cramping and their hips hurt and it's more like a muscle spasm, if they lay down and relax and it goes away, then that's usually a sign that it's musculoskeletal. But if they, they take a soak in a tub or they relax and all those kinds of things and it's not going away, they need to call their midwife or OB and determine what is the cause of pain, what is causing that, because that wouldn't be normal. Another thing is essential oils that a lot of massage therapists use, or maybe a lot of people in general use in their own homes now that they might not think of. Some can be helpful and some can be harmful. And I did put some stuff in the notes, some things that are in your handouts. And if you go to pregnancy essential oil handouts, it'll have like what safe to use here, some synergistic blends, right? And skip here. Did that open?
Dropbox?
The what I have up.
Oh,
This one's not open.
it's loading. There's a little blue circle. Maybe we have it in the Dropbox.
Yeah. Okay. I wonder, I just wanted that to show so you could see this. Let's see, screen sharing. Share new screen. I have to do this every time, how annoying. Okay, share. Okay, now you can see it, yeah?
No, it's still on the screen with the files, but it hasn't. Oh, there it goes. It was just a little slow.
Okay. So these are the pregnancy essential oils. Not all are safe, but these are safe during pregnancy, and it has a synergistic tummy rub and a pregnancy pickup. So let's see. If I go back and back here and here. Hopefully it'll pop up for you. You'll see, I'll just talk because they probably hear me until it pops up over there, that there's one for problems in pregnancy. There's specific oils for specific things. There's one for stretch marks. There's one for babies after they're born. There's one's for labor. There's a list of herbs that are contraindicated and oils that are contraindicated that could cause miscarriage. So check those out. And one of the misnomers of essential oils was peppermint for a lot of years. People still say controversy, like it could stop milk production or this and that. That's not true. Peppermint helps circulation. It can help women breathe. It can change the mood because you associate it with candy canes and Christmas. And so it's actually one of the best oils that I've found to use for pregnancy. You can use it like on low back a little bit mixed with oil for like a biofreeze, kind of an analgesic effect for sore muscles. And so I just wanted to share that with you. So hopefully you can see all that. And then go back to here, here, here. Okay. So in your notes, you're also going to have intake forms, an informed consent, a continued informed consent where every time they come in, they can just do an initial and date is a good thing to have. There's a healthcare provider release form, which is a good thing to have. So if they show up and you hear something you didn't know about, you could email that to the care provider, call them up and just say, hey, I just emailed you this form. Can you give me approval and what I can and cannot do so I can continue and not have to turn this person away? You know, some people still have fax machines. That's great if you can do that. Make sure that you take SOAP notes and document each appointment if you don't normally do that, just so that you have a record of what you did and what you didn't do if it came about. Stay within your scope of practice. If you're not educated on some of the things that are overlapping and out of the scope of practice of massage therapists, then refer out and don't do or say anything that would get you in trouble. And, you know, if you're just watching this and you're not in class, you need to get certified and continue your research. So CYA, yeah, cover your ass. And remember to update yourself with new research and developments and all those kinds of things. There's a handout with hip and leg pain lifestyle recommendations that will help them. Basic things like, you know, exercise regularly and all this and that. And, you know, wear support hose if you're standing all day and rotating your ankles and all kinds of stuff like that. So look in your notes. There's a lot of research and articles and things like that. Okay, so we're going to break for lunch, and then when we come back, we're going to do positioning and draping and go over why we position, when we position, and what's safe and what's not. So we'll take a little break here. All right, so during the first trimester, any position's fine, depending on the comfort of the mother and breast tenderness. The second and third trimesters where it gets controversial. The prone position, the table with the hole cut out of it, with slings and body cushion, pillows, there's like all those different options. So I'll talk about those. So like in this position that she's in right now, the body cushion that's meant for prone when you're pregnant, that's actually good for optimal fetal positioning. And I'll show that on the demo on the pelvis there in a second with the baby. But for massage, not as much. Let's see, and I'll show you why. And I guess it depends what type of massage you do as well. I'm just going to give you the information and then you can decide how you want to position the people. I'm not going to harp at you for like how you have to do things, but it's going to take a second to catch up here too.
I want to learn, because we have the pregnancy support thing, but I want to learn, like I want to do stuff the other way, so I'm well-rounded.
You'll know how to do both, but
Yeah.
I don't promote the prone position at all, and I'll show you why if this advances.
Oh yeah, prone concerns.
There are concerns here. It's mainly the ligaments. There's the uterosacral ligament, the broad ligament, and the round ligament, and I have some illustrations. There we go. It's catching up now. So there you can see the long round ligament that I was showing you with the knitted one. And then the sacral or uterosacral, sacral-uteral, I've heard it both ways, but it goes from the sacrum to the uterus inside there. And then what's kind of a cross section there, like cut off, you can't see because it goes inside the ilium, and if the ilium was there, you wouldn't be able to see. So they took the bone away so you could see. But that broad ligament actually goes inside of the ilium and secures it there. So those are the three main ligaments that are affected when you go prone. On this picture, you can see, this is from Carol Osborne Sheets' book. And on here, you can see that when you go prone, and of course it depends, like, is the stomach hanging through a hole in the table without a sling and it's just hanging down? Like, that's different than if it's like supported.
Yeah,
Okay.
you don't have the cutout.
Right. So with the cutout, and it would be hanging, that's worse for like this compressing the joints and the musculature here. Also this sacral uterine ligament here that gets strained and can even tear and cause lifetime issues there, or it may feel good to lay prone, but then for a little while and then they get up and it hurts really bad. Right, and then they can't walk and all those kinds of things later. So, or lifetime of back pain. With the cushion, the issue is there any pressure on the baby? When you have intrauterine pressure, like in this area here, so if there's pressure down and it's not supported, then intrauterine pressure can actually cause a miscarriage. Just like if you were driving and a seatbelt went and it hit like a lot of pressure on the, you could lose a baby as well too, or somebody punched you in the stomach when you were pregnant. So that's the concern, is the intrauterine pressure. That would be very scary. But with that, I'm going to back up to the positioning here. You're more like in a quadruped or like on all fours, and the cushions are on your pelvis and your rib cage. So there's no pressure really on the baby, and it's not hanging there. And there's been a little bit more research. So when I first taught this, I would say never do this because it would put intrauterine pressure. Now studies have showed that there's not pressure there, and it is an option, but usually it's just for more fetal positioning. You can do it that way now, and I have some of the cushions here, but I pretty much use those for side lying as well, rather than prone. There's a way you can use them both ways. And most of the time I just use pillows, because they're more comfortable, and some of the foam cutouts, and there's different manufacturers of cushions and stuff too. So like some of it's not a one size fits all, and like, are my breasts going to really fit in those holes and my baby in that one? Like they're not all in the same place, and they're different sizes, and sometimes the little foam can like dig in the side of your breast and or in your hip, or maybe you're really short and it's like, all right, the part that's supposed to be in my hip is down by my knees. So it's, like you can do the same thing with pillows. But the problem is like, then you always have pillowcases to change, and that takes time. But unless you do nothing but pregnant women, like just pulling the pillows out for one person isn't a big deal. But if you have multiple pregnant women all day long, then you're gonna go through a lot of pills, and you'll need extra time in between. So I'm just talking a little bit about the positioning before we put you on the table in different ways, and then we'll probably have you get on with your clothes on first and like practice draping and stuff before we do some massage, just so that, like when she's just learning, we don't have any peekaboos and like,
I was always good.
wardrobe malfunction. I'll show you like an easy way to drape, and then I'll show you a more complicated way to drape, and we'll show you multiple ways to position and how to switch side to side and turn people around. And once we get all that done, then we can just like focus on body work for the rest of the days. So, all right. So we know that I just mentioned breech, right? So feet down. There's different ways a baby can end up in the womb, but the baby's skull is heavier and the spine is heavier than the rest of the baby. And when the baby's small and floating around in this bag of waters, it's, like nice little flotation here. The weight with, you're upright, baby's gonna end up head down. And then the baby can be like this way, which would be occiput posterior or occiput anterior, right? So for birth, to have a baby, the easier way is if the baby is this when they're being born, like occiput anterior, because then the face and the mushy part of the baby is against the spine and that, and when they're born, their head kind of comes out this way, facing away from you. So if the baby comes out this way, then the occipital bone and all that, that's when you hear back labor. You've heard of back labor and stuff. That's because it's like putting pressure, and also it's got to get around the coccyx bone and all that, and so that's why it's like kind of attached here, like, because sometimes it breaks off and all that, because like it's got to maneuver and get through there. So there's an easy way and a hard way. if say someone's laying in a recliner most of the day with their feet up, the weight of the baby's going to kind of like go, because that's heavier. And then the bigger the baby gets, it kind of gets like stuck in there. And so then they're most likely going to be birthed with occiput posterior, which is what we're seeing more often now because we're in a more sedentary lifestyle. More people are at home and they're on their computers and sitting more instead of moving around and standing and that kind of stuff. So in the old days when women stayed home and men went to work and they'd stay home and they'd be like, all the countertops in the old houses were low and like they'd be all these forward things, of cooking and mopping and everything was this. And so most babies were that way. And then as we get more into work and whatever, then babies are like having a harder time. But if we're working all day, it doesn't matter what we do. Is like if we spend a majority of our time like moving around and not just in one position, then the baby can figure it out. But what we want, and there's actually some books on the resource list about optimal fetal positioning, is like when the baby gets really big, it's kind of like gotta pick a side or whatever. And so there's the left side is good because the vena cava runs up and down, and I'll have some pictures of that too. So if the baby's on the right side and you're sitting or you're forward, no big deal. But if you're flat on your back and the baby's on the side, it'll compress the vena cava. And that's why they tell you not to lay flat on your back because it puts pressure on there. So I'll talk about that in a minute. So if the baby's here, then when the baby's born, it kind of moves down and out, and it makes it easier for the baby to be born occiput anterior. So, and that makes for an easier labor. So if the way it matters with massage is if, like if somebody wants to lay in that prone positioning, that's really actually good for the occiput anterior because then the heavy part of the baby will go that way against the table and the soft mushy part against the spine. But then if we're just doing Swedish massage or light massage, that's fine. But if you're going to be doing deep tissue massage, that's not okay because then you're pushing on something that's not supported. If you put deep pressure, you're going to have intrauterine pressure that we're talking about, right? Or you're going to compress the nerves in the spine because that's all loosey-goosey with the relaxin hormones and it's going to pinch in there. And it's just not safe. Plus, pregnant women get all mucousy, right? And the breasts hurt. And so it's just not an optimal position for mom or baby unless the baby's in a bad position and they already know that the baby's occiput posterior and the whole point of the massage is to get the baby into a good position. Well, then maybe just doing a nice stress relieving Swedish light massage with the baby in there. But knowing you, and I heard how deep your massages are and you like doing structural work and myofascial and that kind of stuff, that's not the best position for you to be working on people in. If you want to do that type of structural work where you're working with the fascia and moving the hips around, like all that kind of lumbar sacral, you know, all that kind of stuff, sideline's better. We can go side, side, and semi-reclined, not flat on their back.
So the pregnancy support, it's only good like for Swedish, I guess, because it's already going, it could already put intracranial pressure.
Intrauterine pressure.
Yeah, sorry.
Yeah.
Intrauterine pressure.
Right, and that's, yeah, so.
I had no idea. They always come out with those as being really safe. The pregnant, if you go get a massage, they have these things so you can lay face down.
Okay, so that's a precaution and a risk. It's not absolute.
Like the Hippocratic oath, you know, do no harm. And if if there's a possibility that something could happen, why would you take a chance?
Yeah.
When all you got to do is learn a different modality, and that's why you're here. Right?
Yeah.
So we can learn how to do it in a different way. And most people, once they know how comfortable it is, I have them like, they don't ever want to go prone again because they get stuffed up anyway when they're not pregnant in a prone position. I have a lot of my clients who like the sideline position and they don't want to be prone for an hour out of an hour and a half of massage, and they turn over and their eyes are swollen and they can't breathe and all that kind of stuff. So, yeah. So on that picture there, it shows the areas of the joints, the lumbosacral joint, the sacroiliac joint, and the pubic symphysis, which we've already pointed out on the pelvis before too.
And then on the picture on the right there, it shows a round ligament referral pain down the groin. And like I said, you can also feel it up in the rib cage on the upper attachment. The broad ligament can refer, they might feel like they have sciatica pain. They'll say, I have sciatica, when really it's a broad ligament. So it can affect there and it's getting pulled.
I wonder if that's what I can.
Could be. Or it could just be that when the weight of the baby starts, you know, moving this around, and the bigger you get, your hips start going like this. And so then all the muscles here that normally are in a neutral state are like contracted all the time. And then the sciatic nerve runs underneath there, like the, you know, the piriformis is on top of the sciatic nerve, and the poor 10% of people actually goes through the piriformis. And so if that muscle's contracted all the time, it's putting pressure on the nerve. So it could be the sciatic nerve, but if we can get those muscles to relax up in here, then that'll take the pressure off of all of that. It's really kind of hard to, you know, when you do structural work, and so even, all right, this is how you gotta look at, like most people that'll walk in that are right-handed will be tighter in the right pec minor. So they get this anterior medial rotation of their shoulder, which pulls all their musculature of their spine canals like a right thoracic curve over. And then it's got to go the other way. So it's almost like they're developing a scoliosis. And usually I see this a lot in women that are over 60 have that. They have scoliosis from that. But then you see, like, because of that, then the right hip will get higher and go forward. And then the left hip is going to go backward to compensate. And you have all these muscles pulling, and you get SI joint pain. And that can cause the sciatic down the leg too. And so the same thing can happen, but different, like when you have the baby and they're on their left side all the time, it can totally change. So now this is heavier. So now what used to be high is, you know, is switching and turning. And so you get like this weird teeter-totter lopsided stuff, or it makes it worse. Like if it's already up and now you got a baby here, it's even worse.
Yeah.
So all of that, like, it's temporary pain. Because as soon as you have your baby, all that goes away. So we're really not going to be able to fix the structures. What I'm saying,
Just
like,
make it more comfortable.
yeah, we're going to give them a break from it for a while. And if you massage somebody all the way through their pregnancy, instead of waiting till like the last couple weeks of their pregnancy and then starting to work on it, like, you can prevent a lot of that stuff from getting worse if you're working on it through the whole thing. And most of the women that I've worked on from beginning to end, their labors are so fast that I can barely get there. Like, I was known for having these precipitous births where people would have their babies like within 4 hours because their body was so, one, accustomed to body work, but two, it's like a Pavlov dog. Because if a part of having a baby with, you know, as least amount of pain as possible and whatever, you have to be able to relax and just feel and be in your body. And a lot of the things are the same thing as when you get a massage, is to having a baby in labor, you know, like dim light, quiet, you know, and then the physical touch too, and relieving pain. So if every time they see you prior to birth, it's relaxation. I feel better every time I see you. I feel supported. I feel nurtured. You show up to the birth and put your hand on them. It's like, and they have their baby, you know? And then right when I was about to get out of it, I had all these exceptions to the rule. But I also started taking on a lot more high risk births that nobody else would handle and were scared to handle because I knew what I could and couldn't do. I was taking them on, and I feel like they need to be supported too. Nobody wants to help them because they're afraid something's going to happen. And so, I mean, I started dealing with all kinds of stuff and inductions and all this, you know, whatever. And that's not a natural, normal physiological birth, how it would happen. So those, I mean, I'm kind of talking about all the prone stuff here, but then we also have to look at the supine concerns. So if you're flat on your back, I was talking about the vena cava. And when that is compressed, you get what's called supine hypotensive syndrome. And the ACOG is the American Council on Obstetrics and Gynecology. And what they recommend is not to exercise flat on your back for a period of 15 or 30 minutes or more. And I don't know like what you're gonna do flat on your back anyway to exercise, but you know, they first found out about this from in the old days when they used to put women to sleep to have babies, like they'd knock them out unconscious and then just lay them on flat on their back, and then a lot of moms and babies were dying. That doesn't happen now because like if you're conscious and your vena cava gets compressed, you have a reaction. So you could be sound asleep. Like if you're getting sleep, you don't have to worry about falling asleep on your back and like hurting the baby, because you would wake up because you'd feel shortness of breath, you'd feel dizzy or nauseous, whatever, and you'd feel the sudden need to turn on your side. You got to get off of it. A lot of people when they're flat on their back will say like, I feel like I'm drowning, I got to turn.
Yeah.
Just, you know, being cautionary, I have a table here that will recline. I can just click, click, click like one of those old
That's how
pool
I did
chairs.
that, yeah.
Yeah. And if you don't have that, you can use pillows, whatever, or just do side to side and don't lay them flat on their back, just to be safe. If you needed to do like a little 10-minute neck massage or something like that, or maybe even 15, it'd be okay. Just let them know to say something if they don't feel good. But optimally, we would just avoid that. So in the first trimester, it's fine. In the second trimester, you could, 22 weeks is the kind of number that matters when it starts getting too heavy for the baby. And what you could do is put a pillow under the right hip to kind of tilt the pelvis. And then the baby would go to the left side and be off of the vena cava. But after the 22-week mark, then it's still too heavy. You got to recline them at that point. But I don't like the pillow under the hip because that makes your SI joint teeter-totter even more. And if there's already SI joint pain, that's just not going to feel good.
Yeah.
You know, and if they're there for structure work or whatever, that doesn't make sense to me. But yeah. But if they didn't want to move and you were just going to work on their neck and they felt good otherwise, and you just wanted to like, you know, if they were just like, oh, just finish it, but I want to roll a little, you could tuck a pillow under the right hip and kind of get away with it up till 22 weeks. And then don't do it at all. So sideline is a lot easier. You can do deep tissue safely. It reduces uterine ligament strain. You don't have any sinus congestion. It's easier to talk and share, and avoids hypotensive syndrome and all those kinds of things. So I just talked about optimal fetal positioning. That's what this slide was about. So I already talked about that. The roller coaster bar, somebody calls it, but the squat bar, there's different options of having your baby. Like you can squat, you can lay on your left side. You don't have to lay flat on your back. If you want to have an easier birth, there's more information in the notes about that. And to have the baby be in an optimal fetal position, you just kind of want to avoid positions where your knees are higher than your hips, like most office chairs. So you want because if your knees are higher, you are in a posterior tilt, right? So you're gonna go this way, which makes the baby go that way. Whereas if you're on the edge of your chair and your hips are this way, anterior tilt, that makes the baby go into anterior and makes it easier. It's the mushy part against the spine. And just avoid laying for long periods of time on your back. So then there's all these other things, obviously, the opposite of those things. And then this is just a slide about things you could try to turn a breech baby. We can talk about those during labor again because we want to get on the table, but there's some little things to do.
You want the baby on the left side for this, so it doesn't affect the
Vena cava.
vena cava.
Yeah, but it really doesn't matter if you're on your side, you're fine. It only affects when you're flat on your back.
Okay.
If the baby's on the left side, it's optimal, but there's still enough circulation going through there if they're on the right side. As long as you're on your side or vertical or semi-reclined, you're fine.
Okay.
Want a fun fact?
Yeah, let's hear it.
You know how most people are like right-handed and there's just a few people that are left-handed? So like most babies when they're in the womb end up on this left side of the body. And I read this article about like how there's that vestibular stimulation to the brain as the bag of water starts affecting the brain and stuff. And that babies that are like this, they're all right-handed. Some babies end up on the right side and they get really comfortable on the right side, and that's fine. You know, they're not really, you know, compressing the vena cava again, unless you're laying flat on your back, and your body will tell you if you're compressing that because you'll feel weird. You'll turn. But all the babies that end up over here, they tend to be left-handed. And I've been asking around over my own personal to see, because that was like a theory that I read. But my second daughter was on the right side and she's left-handed. And every person I know whose baby's on the right side, they're left-handed. So I think it's true. So I don't know. I have to do a survey, do some more research, but I thought that was kind of a fun fact myself. All right, let's see. All right, so we're gonna do some different setup variations.